صلوا عليه اللهم صل على محمد. راحي كريم عظيم عليم حليم حكيم متين منان رحمن فتاح غفار تواب رزاق شهيد حسيب اللهم صل على محمد وآل محمد. يا مسلمين صلوا عليه اللهم صل على محمد. راحي كريم عظيم عليم حليم حكيم متين منان رحمن فتاح شهيد حسيب اللهم صل على محمد وآل محمد. يا مسلمين صلوا عليه اللهم صل على محمد. راحي كريم عظيم عليم حليم حكيم متين منان رحمن فتاح غفار تواب رزاق شهيد حسيب اللهم صل على محمد وآل محمد. يا مسلمين صلوا عليه اللهم صل على محمد. راحي كريم عظيم عليم حليم حكيم متين منان رحمن فتاح غفار تواب رزاق شهيد حسيب صل على محمد وآل محمد. يا مسلمين صلوا عليه. اللهم صل على محمد. راحي كريم عظيم عليم حليم حكيم متين منان رحمن فتاح غفار تواب رزاق شهيد حسيب حليم. اللهم صل على محمد وآل محمد. يا مسلمين صلوا عليه. اللهم صل على محمد. راحي كريم عظيم عليم حليم حكيم متين منان رحمن فتاح غفار تواب رزاق شهيد حسيب حليم. اللهم صل على محمد وآل محمد. يا مسلمين صلوا عليه. اللهم صل على محمد. راحي كريم عظيم عليم حليم حكيم متين منان رحمن فتاح غفار تواب رزاق شهيد حسيب حليم. اللهم صل على محمد وآل محمد. يا مسلمين صلوا عليه. اللهم صل على محمد. راحي كريم عظيم عليم حليم حكيم متين منان رحمن فتاح غفار تواب رزاق شهيد اللهم صل على محمد وآل محمد يا مسلمين صلوا عليه اللهم صل على محمد. راحي كريم عظيم عليم حليم حكيم متين منان رحمن فتاح غفار تواب رزاق شهيد اللهم صل على محمد وآل محمد يا مسلمين صلوا عليه اللهم صل على محمد. راحي كريم عظيم عليم حليم حكيم متين منان رحمن فتاح غفار تواب رزاق شهيد اللهم صل على محمد وآل محمد يا مسلمين صلوا عليه اللهم صل على محمد. راحي كريم عظيم عليم حليم حكيم متين منان رحمن فتاح غفار تواب رزاق شهيد اللهم صل على محمد وآل محمد يا مسلمين صلوا عليه اللهم صل على محمد. راحي كريم عظيم عليم حليم شهيد اللهم صل على محمد وآل محمد. يا مسلمين صلوا عليه. اللهم صل على محمد. راحي كريم عظيم عليم حليم حكيم متين منان رحمن فتاح غفار تواب رزاق شهيد اللهم صل على محمد وآل محمد. يا مسلمين صلوا عليه. اللهم صل على محمد. راحي كريم عظيم عليم حليم حكيم متين منان رحمن فتاح غفار تواب رزاق شهيد اللهم صل على محمد وآل محمد. يا مسلمين صلوا عليه. اللهم صل على محمد. راحي كريم عظيم عليم حليم حكيم متين منان رحمن فتاح غفار تواب رزاق شهيد اللهم صل على محمد وآل محمد. يا مسلمين صلوا عليه. اللهم صل على محمد. راحي كريم عظيم عليم حليم حكيم متين منان رحمن صل على محمد وآل محمد. يا مسلمين صلوا عليه. اللهم صل على محمد. راحي كريم عظيم عليم حليم حكيم متين منان رحمن فتاح غفار تواب رزاق شهيد حسيب اللهم صل على محمد وآل محمد. يا مسلمين صلوا عليه. اللهم صل على محمد. راحي كريم عظيم عليم حليم حكيم متين منان رحمن فتاح غفار تواب رزاق شهيد حسيب اللهم صل على محمد وآل محمد. يا مسلمين صلوا عليه. اللهم صل على محمد. راحي كريم عظيم عليم حليم حكيم متين منان رحمن فتاح غفار تواب رزاق شهيد حسيب اللهم صل على محمد وآل محمد. يا مسلمين صلوا عليه. اللهم صل على محمد. راحي كريم عظيم
Assalamualaikum warahmatullahi wabarakatuh and a very good day. Warm welcome to all beloved respective speakers and participants. I would like to remind all participants to remain mute as our program will begin shortly. Thank you very much. Bismillahirrahmanirrahim. Alhamdulillahi Rabbil Alamin. Wassalatu wassalamu ala ashrafil mursalin wa ala alihi wa sahbihi ajma'in. Alhamdulillah. Honorable Prof. Dr. Jamaluddin Abdul Rahman, Dean Kulliyyah of Medicine, Prof. Azina binti Maralid, Deputy Dean Kulliyyah of Medicine, Honorable invited speakers, Prof. Dr. Wan Azman Wan Ahmad, Prof. Aminuddin, Prof. Dr. Arif, Ustaz Abdul Rahman, Prof. Nazri, Prof. Dr. Ibrahim, honorable committee members, lecturers, colleagues, postgraduate students, brothers and sisters, Assalamualaikum, good morning, and warm welcome to Kulliyyah of Medicine Postgraduate Clinical IIMP Workshop 2022. For your information, this program intended to provide practical understanding among clinical postgraduate students, Kulliyyah of Medicine IIUM, on the following topics: principles of Tawheed in clinical practice, Fiqh Al-Ibaadah in medicine, Fiqh Muamalah in medicine, professionalism and ethics in medical practice. To gain the barakah and blessing of this event, I would like to invite Assistant Prof. Dr. Iman to recite the dua.
Bismillahirrahmanirrahim. Alhamdulillahi Rabbil Alamin. Wassalatu wassalamu ala ashrafil anbiya'i wal mursalin wa ala alihi wa sahbihi ajma'in. Allahumma ja'al jam'ana hadha jam'an mubarakan marhuma wa tafarruqana min ba'dihi tafarruqan mubarakan ma'suma wa la taj'alillahumma fina wa la ma'ana shaqiyan wa la mahruma. Rabbana 'alaika tawakkalna wa ilayka anabna wa ilaykal masir. Allahumma tawil a'marana وصحح أجسادنا وثبت إيماننا ووسع أرزاقنا وحسن أخلاقنا ونور قلوبنا برحمتك يا أرحم الراحمين. اللهم اجعلنا من أهل الخير واجعلنا من أهل البركة واجعلنا من أهل المغفرة. اللهم اجعلنا من أهل الجنة واجعلنا من أهل الفردوس الأعلى برحمتك يا أرحم الراحمين. اللهم اجعل مجلسنا هذا مجلسا مباركا لأصحابنا وأهلنا وجيراننا وضيوفنا برحمتك يا أرحم الراحمين. ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار. وصلى الله على سيدنا محمد وعلى آله وصحبه أجمعين والحمد لله رب العالمين.
Amin, amin, ya Rabbal Alamin. Thank you very much, Dr. Iman. Without further delay, to start and officiate this program, I would like to invite Prof. Dr. Jamaluddin bin Abdul Rahman, Dean Kulliyyah of Medicine, to give his opening speech. Please welcome Prof. Falyatafaddal mashkura.
Bismillahirrahmanirrahim. Alhamdulillahirabbil alamin wassalatu wassalamu ala sayyidina Muhammad wa ala alihi wa sahbihi ajma'in. Subhanaka la ilma lana illa ma 'allamtana innaka antal alimul hakim. Rabbi shrah li sadri wa yassir li amri wa hlul 'uqdatam min lisani yafqahu qawli. Assalamualaikum warahmatullahi wabarakatuh, especially to Dr. Saiful, currently the head for Islamization of Human Knowledge unit for Kulliyyah of Medicine. He's looking into the Islamization aspect of undergraduate, postgraduate, as well as for staff. I also would like to thank Prof. Azrina, Office of Postgraduate, for facilitating this particular program. And also definitely to the beloved students, postgraduate students of IIUM, and not forgetting our distinguished speakers from Dr. Wan Azman. He might not remember me, but I remember him definitely, because when I was a medical student in UKM last time, even though he is in UM, he frequent our college, our CAMSIS in Titiwangsa, and he keep on coming to give bayan, to give tazkirah, to keep reminder our duty as student, our duty as Muslim. For me, he's a true murabbi, and the one that able to practice medicine very well, definitely, as a cardiologist, and able to show the good akhlaq that can be emulated and inspired by all of us. Also, all the other speakers, for example, like Prof. Amin, my friends, Prof. Arif, also my teacher. I met him when I was year 4 doing NS posting. and also Susmac for helping us in delivering this topic of Islamization. For fellow students, maybe you are wondering, most of you joined IIM. Some requested to join IIM, yes, but during the entrance interview, you are somehow allocated the university rather than going to the university of your choice. And many actually are asking, perhaps, especially those who are not aware of IIM, what are you doing in the Islamic University, so-called International Islamic University? What is the purpose, the vision and the mission of the university? Obviously, definitely, we are not here to Islamize people to become Muslim. That is not the priority of the university. But more than that is that we believe, I believe all other religions also the same, in the sense that we believe in the good outcome of anything that we do. We want to have the integrity that we want as a doctors. Example, like being a doctors, or even as human being, integrity is very important. And as a fellow doctors, our job is to make sure that people safe, people who come to see us when they are sick, when they go back, they have a very good quality of life. When they come with problems, we try our best with the knowledge and the skill that we are learning, that we have. We treat them, they become better, they can go back and serve their function as husband, serve their function as brothers, the sisters, the wife, so they can contribute back to the community. However, I've been telling everybody, for the Muslims, we believe life after death. So no matter what kind of disease that we have, we endure in our life. So the ultimate consequence, sequelae of that disease is death. But for Muslim, we believe there is life after death. Therefore, our challenge, our life does not stop when we die. So we have these patients coming to see us, and even if they have the worst case of physical illness that they may have, all the complications, cancer that mets everywhere, we might not be able to save the person. But if we are able to help them to accept whatever that they are having, so they die in peace, so they please Allah, the creators. So that is what we want. So even if they suffer in this world, they are not going to suffer in the hereafter. And for those who help a person to believe, or to believe this and to see Allah with a good iman, I would say, a good belief, a good ethics. So hopefully Allah also reward us the same. So when we are here in Kulliyyah of Medicine, at the moment, for your information, IIM is embarking upon what we call as Sejahtera Academic Framework. In the Sejahtera Academic Framework, we used 4 principles of the process that we do in our day-to-day in the university. We talk about empowerment. That's why in this particular process, in this particular event that we have for these 2 days, we are going to empower you as well. Even though we are going to have these 4 different important modules for you to understand what it is all about, we also would like to empower you to give your feedback to contribute in this particular program. And then we also have flexibility. The way we conduct this workshop, for example, like in many courses, is as simple as giving lecture and then you listen. Whether you listen or not, eventually that's the end of the delivery of the session. But in this case, we have a dialogue session, we have a workshop session, so that we are able to understand the subject that we are discussing. And we also need innovation. So again, the creation of this, by doing this online, hopefully you also benefit from this particular event and all other sorts of innovation that we can create. And at the end of the day, whatever we do, we must be accountable to whatever we created, whatever we agreed upon, whatever we decide. So this particular program, when the designer of the program initially was great people in the Kulliyyah, Also, I would like to shout here is Dr. Arif Saha, who is currently in Avicenna, and also Dr. Faiz Tahir, who is currently our psychiatrist in the Kulliyyah, who contributed a lot for this particular 4 modules. So I think this is a good modules that I hope is going to be very practical, because if you look at the topics, we also cover something which is very sensitive, something like breast milk for Muslims. It is not something that easily acceptable by Muslims, because there are laws with regard to protection of progeny, for example, Maqsid Sharia, that related to the breast milk. When you share the breast milk, there's a consequence of relationship in Islam. But we, as I believe yesterday, our Maisuri Agong officiated the breast milk center. So we want to tell the world that it is possible. So that Islam is not restrictive. We also have issue with regard to gender dysphoria, for example. When the world are talking about pride, about being inclusivity, everybody is inclusive, but there are certain boundary that we should be very careful. There are limits to so-called freedom that people are shouting about. There are things that we know that we can't. If we talk about freedom, people can do everything they like, including smoking wherever they like. You can smoke, but you can't smoke anywhere. So there's a difference between freedom and regulations. So I believe even our our body, we can't eat everything that we like, even though we can, but we should not, because it can destroy our own body. So even though despite those freedom that we have, there are certain limit that we should understand why religion and prophets alayhi salam and God told us what to do. So there are things, there are regulations. Some may believe, some may not. So over this 2 days period of workshop, I hope we can discuss. I hope we can, more important than discussion, more important than listening is to contribute your opinion. And more important than that is at the end of this particular session, for us to internalize whatever we have learned, so that we are able to become a good specialist at the end of these particular programs in IIM. So with that, I thank again Dr. Saiful and the organizers for organizing this. I hope that all of us will have a very good workshop, inshallah, throughout these 2 days. And with that, with lafaz Bismillahirrahmanirrahim, I officiate IIM Postgraduate Clinical Islamic Medical Program in Islamic Medical Practice for workshop. Thank you.
Thank you very much, Prof. Jamal, for your wonderful opening speech and officiation of the program. With that, let us view a short video prepared by the RHK committee members that will enlighten us about the structure of this program regarding Postgraduate Clinical IMP Kulliyyah of Medicine IIUM. Alhamdulillah. So the video just now actually enlightened us about the flow of our program Clinical IIMP since the early of this year until today. So we realized that basically the program starting with a series of lectures by Centuries, Center of Islamization from Kuantan campus. And after that, all the students have been given ready materials for them to do self-study and also to identify the important points from the reading materials, and also able to get some understanding about the objectives of each reading materials and able to apply in their daily activities and also clinical fields. And the peak of the program will be today, whereby we gather all in this virtual program in order to discuss about the important topics, practical things that we face every day in our clinical field. Before we begin the session of today, let me explain about the flow of the day. This event consists of 2 days workshop. The lectures will be on the morning session of today, followed by group presentation and discussion by the postgraduate clinical students, which will be continued until second day, which is tomorrow, and will be ended by a forum also participated by the students as well as the IUSK members. There is slight change from the initial tentative for today. The first slot will be delivered by Ustad Abdul Rahman Al-Azmi for the Fiqh Al-Ibaadah in clinical practice, and after that will be followed by the subsequent lectures as planned. A bit information about our invited speaker, Ustad Abdul Rahman. Our speaker is currently the Assistant Director of Sharia Compliance Unit of SASMEC Hospital. He had involved in major training of staff and community with regards to Islamic concept and education. He had received previously his degree in Sharia Islamic law from Al-Imam Muhammad Ibn Saud Islamic University, Riyadh, Saudi Arabia. Now I would like to invite Ustad for the session. Ustad Abdul Rahman, falyatafaddal mashkura.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi ta'ala wabarakatuh. Alhamdulillah, nahmadu wa nasta'inuhu wa nahdihi wa nastaghfiru wa natubu ilayh wa natawakkalu alayhi wa na'udzu billahi min syururi anfusina wa min sayyiati a'malina. May yahdihillahu fala mudilla lahu wa man yudlil fala hadiya lahu. Asyhadu an la ilaha illa anta astaghfiruka wa atubu ilaik. First of all praise to Allah Subhanahu wa Ta'ala for giving us an opportunity for today, for event today, to attend this program, this workshop. Thank you very much. First to Prof. Jamaluddin, from Dr. Jamaluddin, Dean of Kulliyyah of Medicine, Dr. Shafir Ehsan, Coordinator of IOHK, for inviting me to give the speech or talk today, and fellow speakers, which is Dato and professors, organizing committees, and all the participants. Inshallah, today we will lecture or giving a discussion about the topics, which is overview of Fiqh Ibadah in medicine. This is a topic of discussion for today. First, we are going to discuss about the fiqh, what is the definition of fiqh, sources of fiqh and context of fiqh. And then we have 4 schools of thought, Sunni school of thought, then a scope of fiqh. And then we proceed to the second part is ibadah. What is ibadah? What is concept of ibadah in Islam? Maybe different from the religion. And then the common misconception about the ibadah. Then we proceed to the more focus, which is ibadah in medicine. And then we can go to the principle of fiqh related to ibadah in medicine. And then also one of the most important principle in ibadah in medicine is also concession, which is different from the ibadah in the other place. What is also objective of the also? What is category, condition, types, application? And the last is common issue related with ibadah among patients. First one is fiqh. What is fiqh? Fiqh, kita biasa dengar fiqh. What is fiqh? Fiqh in literal meaning means deep understanding. It's not just understand. Fiqh is deep understanding. It's based on a hadith narrated by Muawiyah. Rasulullah SAW said, "Man yuridillahu bi khairan yufaqihu fid din." Whatever Allah wants good for, He will grant him fiqh, which is deep understanding of the religion. According to Muhammad Abu Zuhra, one of the fiqh scholar, Fiqh is the knowledge of the Shariah rulings which are related to action of mukallaf. Action of mukallaf. It's not about the others, it's not about the Tawheed and so on, it's about the action, practical, from its detailed sources, which is Al-Quran, Sunnah, Ijma', Qiyas, and others. That's Masalih, Musalah, and others. But this four is consensus from the ulama, these sources, the consensus by ulama. Al-Quran, As-Sunnah, Ijma', and Qiyas. In a short way, this is a fiqh. First, it's a deep understanding, and then it related to action or practical of mukallaf. So it's very important to know is fiqh is related to action and practical. Okay, and then the main sources of fiqh is Al-Quran, As-Sunnah, Ijma', and Qiyas. This is a consensus by ulama and others, such as Masalih Musalah, such as Amal al-Fiqh and others. And fiqh, the discussion of fiqh involves about 5 things. First is wajib, compulsory, or haram, prohibited, sunnah, recommended, makruh, disliked, and mubah, permissible. So all the fiqh, all the practical action, it must be either one. Wajib, compulsory, or prohibited, recommended, disliked, and permissible. This is a fiqh. It's a short way how to understand what is fiqh. Okay. There are 4 Sunni school of thought mazhab in fiqh. Actually, we have some, but it's the most famous, and they have their people that follow until now. This for Sunni. We have a Shia school of thought, but it's not for our discussion. Okay. The first one is, we start from Hanafi. Hanafi, the founder is Nu'man Abu Hanifah. The second one is Maliki, which is founded by Malik bin Anas, Malik bin Anas. And then Shafi'i, Muhammad bin Isa al-Shafi'i. And the last one is led by Imam Ahmad bin Hanbal, so-called Hanbali. So these 4 school of thought in fiqh. That's why we can see that we have many opinion, because at least we have 4 Sunni school of thought that they have a different way, maybe different way of how they understand the sources, the Al-Quran, Sunnah, and so on. We're talking about scope of fiqh. Actually, it's cover all aspects of life. Ulama divide scope of fiqh into 7 scopes. The first one is fiqh al-Ibaadah. It includes ablution, wudu, prayer, fasting, zakat, hajj, and so on. And then the fiqh is fiqh al-Usra. It's about family, or fiqh al-Munakahat, about marriage, divorce, kinship, and so on. Third one is fiqh al-Muamalah. Muamalah is about relationship between human and other human, such as transaction, sale, purchase, rental, financing, and so on. And the fourth is fiqh al-Jinayah or al-Uqubah. It is involved in punishment to certain criminal, such as qisas, hudud, and so on. The fifth is fiqh al-Ahkam as-Sultaniyah or Siyasah al-Syariah, which is obligation and responsibility as ruler, government, people, and so on. And then fiqh alaqah al-Dawliyah or Siyar, about international relations. And the last but not least, fiqh al-Adab wal-Akhlaq, which is good moral and manner. So when we see at all the 7, it cover all aspects of life, from your ibadah, from starting until akhlaq and adab. And muamalah, what you need to have a relationship with other human, you go to shopping complex and so on. And we have ahkam sultaniyah, about the government, and international relations, about Malaysia and other countries, for example. So fiqh is cover all aspects of life. Then we proceed to the next part of our discussion today is ibadah. What is ibadah? Because the topic is fiqh, ibadah, in medicine, we need to know fiqh first and then ibadah. Ibadah is come from words of abadah, which means submission and surrender. According to Oxford Dictionary of Islam, ibadah means worship and acts of devotion. It's ibadah. Ibn Taymiyyah, in his book Al-Ibaadah, he said that ibadah means it is a comprehensive term that encompasses all what Allah loves of words and deeds. All what Allah loves of words and deeds, whether in word or out, is ibadah. And then Ibn Qayyim, he defined ibadah as a worship, is the utmost degree of love to Allah, while accompanied with complete surrender. So, utmost degree of love of Allah and complete surrender is ibadah. Then it's a more comprehensive definition of ibadah by Sheikh Abdul Rahman bin Nasir Al-Sa'di. Ibadah is a comprehensive term, include all what Allah loves of belief first. Then in word and outward deeds, doing good deeds or refraining from sins is also considered as ibadah. This is ibadah. So ibadah in Islam is wide. It's not just only go to pray and so on. Ibadah is more than that. The concept of ibadah in Islam, the first one, ibadah as a Muslim, we must know that ibadah, one of main purpose of our life. Allah said in the Quran, وَمَا خَلَقْتُ الْجِنَّ وَالْإِنسَ إِلَّا لِيَعْبُدُونَ. Only to perform the ibadah. And then concept ibadah in Islam is easy and practical to all human beings, including patient at the ward, including their illness patient, the dying patient. So ibadah, the true ibadah is practical. And then ibadah not limited to the 5 pillars of Islam only. Ibadah not about salah, about fasting, about zakat and hajj only. More than that. More than that. So ibadah is any pure deed performed with sincere intention, obey and please Allah. Any pure deed. Apa yang baik, this ibadah, but accompanied with sincere intention. So there are two requirements of ibadah. The first is ikhlas, which is sincere only to Allah Almighty. So someone that perform the ibadah, maybe he perform pray one night for 100 raka'ah, for example, but not for Allah, but for the sake of human, for example. So it's not considered as ibadah. The first one is ikhlas. Maybe you just pray 2 raka'ah, but you sincere only to Allah Almighty, more valuable than someone who pray 100 raka'ah in one night, but for other purpose. This is the first one. The second one is follow the guidance of Prophet Muhammad and not contradict with the general principle of Sharia. So someone who may be ikhlas, but he create the new ibadah, not follow the guidance of Prophet Muhammad, so it's also not considered as ibadah. He ikhlas, someone ikhlas to help others, but he still stole the stuff from others to give, like Robin Hood. Is ibadah or not? It's not ibadah, because not follow the guidance of Prophet Muhammad. Maybe ikhlas, but not follow is also not considered as ibadah. So ibadah must consist of two things, ikhlas and follow the guidance, and also not contradict with the general principle of Sharia. Then this is a common misconception of ibadah in healthcare settings. First is patient. What can I see a patient at Sultan Ahmad Shah Medical Center and maybe other places who admitted to hospital at the ward, they think that they are exempted to perform any ibadah, such as or ibadah that need to perform every day, prayers or fasting during Ramadan, or not need to covering the hour. This is a misconception, because ibadah, even you are dying or you are lying down, you need to perform the salah, but based on their condition. Then family members, healthcare professional, including doctors and nurses, also have misconception. They thought that the patient is dying, it's lying down, so no need to do anything. Sometimes we need to consider, we need to look again. Okay? And also professional doctors and others also have misconception that their duties are limited for providing various types of medical and nursing care only. But actually, they need to help and educate patients and their relatives on obligation as Muslim, such as prayer and fasting and so on. So this misconception need to overcome by healthcare personnel that involved directly with the patient at the ward and so on. Now we proceed to the more specific about fiqh ibadah in medicine. Fiqh ibadah in medicine. I'm already said about scope of fiqh. We have 7 scope of fiqh. One of them is fiqh ibadah. And fiqh ibadah, the more specific is fiqh ibadah in medicine. So we start with scope of fiqh. One of scope of fiqh is fiqh ibadah. And in fiqh ibadah, we have fiqh ibadah in medicine. Because fiqh ibadah may be in medicine, in your home, in other places. But we are going to focus on fiqh ibadah in medicine. Okay. You can see all 7. So our discussion, my lectures is about the first one is the ibadah. One of the scope is the ibadah, and then we focus the ibadah in medicine. The ibadah, we have too many things like wudu, ablution, tayammum, salah, prayers, janazah related matters, also in the ibadah, cleanliness of body, clothes and place from najis, usul or obligatory baths, fasting, and we also have azan in iqamah. But azan in iqamah is not directly related to the ibadah in medicine. Zakat is not directly related to the ibadah in medicine. It's also hajj or pilgrimage. It's also maybe some of condition, but most of the time, most of the condition of hajj is not directly related to the ibadah in medicine. But in other part, maybe for example, someone who for the woman have no menses or have a menses, how to do the tawaf and so on. But most of other part is not involved, but maybe some of part only involved the ibadah medicine for the hajj. Okay, fiqh ibadah in medicine first not necessarily involve all the topic issue discussed in fiqh ibadah as general. So fiqh ibadah in medicine more focused on ibadah of patient during illness or involving medical procedures. So fiqh is understand ibadah in medicine, how to perform ibadah during illness, such as cleaning up the clothes, place of body from najis, taking ablution or tayammum, from prayer, fasting, Ramadan, and others. This fiqh ibadah, understanding on how to perform ibadah during illness. So the understanding is need to come from the healthcare personnel, such as doctor, so from the patient. Principle of fiqh related to fiqh ibadah in medicine. There are some principle we need to understand first, which is related to fiqh ibadah in medicine, which is very important. We need to know this principle. First, no harm, do no harm, and do no get harm. La darar wa la dirar. Someone who has dying, unable to move, but we ask him or the patient to perform prayer like usual. It maybe give the harm for the patient, so it's contradict with the principle of fiqh related to fiqh ibadah. So do no harm and do no get harm. Second one is dar'ul mafasid awla min jalbil masalih. Removing harm will be preferred over providing benefit. For example, someone who can unable to use water for wudu. This is the best one. You perform the wudu, you do the wudu with water. But if you use the water, it can worsen your condition, for example. So we need to remove the harm. So no need to use the water, use the alternative and so on. Then hardship is to be removed. Any hardship need to be removed. Al-darar yuzal. This is a third principle. First, second, and third principle related to ibadah. And we have other principle. Then al-darar ashad yuzalu bid-darar khaf. The bigger hardship is to be removed by a smaller hardship. When we do something in ibadah, it's a good, but we need to remove the bigger hardship, which is maybe will make the condition patient worse. So we need to remove it first and then perform ibadah based on their condition. And then ad-darar la yuzal bimisli. A hardship cannot be removed by an equal hardship. So any hardship can remove by equal hardship. It can remove by small hardship only. But if it is equal, you can remove because you free from other hardship and other hardship will come. So same. So in Islam, in principle, it's not permissible. We need, if we want to remove hardship, must be a smaller hardship, not the equal hardship. And then al-darurah tuqaddir biqadariha. Allowance of prohibition is limited to the extent and specific time of need. For example, patient who are unable to move and not have any relative accompany them. So they can do salah in jama', which is, for example, Zuhr and Asar, you perform in one time. Same time, maybe Zuhr or Asar. Because you have a darurah condition. But when your relative is coming or you can move to perform to do the wudu and so on, so you need to perform salah according to their time. So ad-darurah tuqaddir biqadariha. So limited to the extent and specific time of it. Then ad-darurah tubihul mahzurat. Necessity allow use of prohibited things. There are things that are prohibited. For example, you need to consume non-halal medicine or sun-based, for example. But they are the only and the best medicine you need to consume. So you can do it because ad-darurah tubil mahzurat. Necessity allow use the prohibited things, but as I mentioned before, allowance of prohibited is limited to the extent and specific time of need only. When you no need to consume, so you can consume the prohibited base. But when you need this, the best one, the only pilihan yang ada, so you can consume. The next principle is a thing which is allowed on specific text and that justification finish, then the allowance mitigation will also finish. Ma jaza li'uzri al-batal li zawalihi. For example, as I mentioned before, you can pray jamak prayer because you can't move. For example, you not have any relative that or personal such as nurses can help you to do the wudu. So you can jamak. Then after, maybe sometime after this, after that time, then your relative is coming, for example, and the nurses can entertain you. So you can tak boleh dah do jamak prayer, so need to solat macam biasa, for example. And then al-masyaqqah tajlibu at-taysir. When you are in a hardship condition, you can do the easier things. This is a principle of fiqh related to fiqh ibadah. We need to understand, then we can apply in healthcare, any healthcare setting, especially at war, OT, and so on. And then we are going to discuss more further about the most important principle of ibadah and medicine is rukhsah, which means concession. What is rukhsah? Rukhsah in literal meaning is meant to ease. Yeah. In fiqh definition, is a temporary permission of an otherwise non-permissible or prohibited action or substance in a particular situation as per essential in the large interest of humans. It's not permanent, it's temporary permission. Okay, buat apa? Buat sementara yang mana yang waktu biasanya tidak dibenarkan. Otherwise not permissible or prohibited action. Waktu biasa tak dibenarkan, tapi dalam keadaan tertentu as particular situation, as per essential equipment. Jadi dalam keadaan tertentu diperlukan sahaja. Okay, the second definition of rukhsah is certain exemption of facilitation provided by Allah during ibadah under certain situation. Not all condition, not all situation, not is under certain situation only. So we need to understand that rukhsah is a temporary permission or under certain situation. But the normal condition is prohibited. But in some condition, for example, during illness, dying, and so on, so that thing is permissible. Okay. What is objective of rukhsah? We give the easier thing, concession, and so on. What is our objective? This is the same objective with the maqasid syariah, with the objective syariah. The first is to protect the religion. Because of what? Because someone want to perform their obligation with his religion, but unable to do. So, in order to protect the religion, the obligation as a Muslim, he or she or the patient need to do rukhsah, the concession, in order for them to perform their obligation. And the second one is clearly to protect the life. Protect the life because in some condition, patient unable to do ibadah as easily. Perform wudu, salah, fasting, and so on. So the aim or objective to do the rukhsah in fiqh ibadah is to protect the life. And then the third objective is to protect the progeny. Progeny, as mentioned by Dean of Islamic, Prof. Jamaluddin, one of these protect progeny. So very important to understand about ibadah, to protect progeny in some conditions, especially at the ONG and so on. And then to protect intellect and mind. It's also in ibadah, which is we have a rukhsah to protect our intellect or mind. And the last one, to protect the words. In some condition also, the rukhsah or concession to protect the words of human. There are five rukhsah, objective of rukhsah or concession. Okay. Then we proceed to the category of actions allowing rukhsah concession. First category is daruriyat. We need to know this category before we decide whether this condition is allowed to do rukhsah or not. We need to understand, we need to know what the condition, the category of condition. Because some of condition is not allowed to do rukhsah. But in other condition, it's allowed. The first one is daruriyat. Action that could lead to loss of life, for example, or was the vital organ condition, for example. This condition is clear indication of rukhsah. The second one is hajat, the action that may result in difficulty. One may experience more than usual difficulty, but that does not lead to any loss of life or vital organs. This may become a reason for rukhsah, but depending on the person and option of endurance, azimah. In the azimah, which means in normal condition. So in medicine, most of condition, most of time, maybe daruriyat or hajat. But there are maybe some condition which is tahsiniyah, is recommendable action. Action in which one may or may not bear any hardship or have only little difficulty. So in this condition, it's not allowed to do so. So what I can see at the box on the condition of patient, maybe the category is darurat and hajat. But sometimes we need to observe, maybe it come under tahsiniyah. It's not need to do any rukhsah. This is a condition where rukhsah concession is allowed. There is some condition is called rukhsah is allowed. The first one, during journey which is safar. For example, you are going to conference, you stay at Kuantan and want to go to Kuala Lumpur. So you can make shorter your prayer, which is qasar. And you can do jama'. It's a prayer because of what? Because of safar. It's also for fasting. When you are on journey, on musafir, you can break your fast. You can break your fast because of what? Because of safar. Not because you are dying and so on. Not because when you use a car, you don't have any problem. But because of safar, you on journey, you can do it. But the best way, you can continue with your fasting. But if you break your fast, tidak ada kesalahan. Second one is disease, which is marad, is close directly related to the ibadah in medicine. For example, as I mentioned before, is prayers. You can do jama' and so on, and you can change the way you salah, you pray. For example, instead of you perform the prayer in standing position, you can on sitting position or lying down on your bed and so on. There's also ablution. For example, ablution, you do the wudu, some of part you can wash, because you have bandage and so on, so you can perform wudu not as usual. We can discuss later about this topic. And the third one, the condition that allow to do so is nisyan, forgetfulness. For example, when you forgot to perform the prayer, so tidak berdosa. So when you bila dah ingat, do the prayer as soon as possible. Same goes to fasting. Bila tak ingat, makan sebagainya, maka bila ingat balik, our fasting is also valid. So it's nisyan. The fourth is ignorance, with jahal. For example, children, baby and so on, so they not have any knowledge. Tidak tahu do and do's. So it's allowed to do rukhsah, dibenarkan kalau meninggalkan setengah perkara. Fifth is prevalence norms of. For example, mahar of marriage, mahar ni is according to the prevalence norms. Last one is defect, naqs, defect in body or intellect. For example, individual with mental disorder or unconscious. So some ibadah maybe not need to do because of defect. This is a condition where concession with rukhsah is allowed. Then we proceed to the type of rukhsah. There are some type of rukhsah. The first is delay action. Type of rukhsah is delay action. For example, jamak prayer for dying and illness patient. Okay. For example, for the dying patient, he can't do the salah zuhur, but in asar, he can do the salah. So the salah zuhur prayer and asar prayer, he will perform during asar prayer time. For example, for those just post operation, for operation, and in condition unconscious, tak sedar sebagainya. So dia sedar dah petang, so he can do the Zuhur prayer and Asar prayer during Asar prayer. It's a type of rukhsah delaying action. Second one is exemption, which is takhis exemption. For example, for the men, for Muslim men, they are not allowed to wear silk. But in case of allergy, it is silk the only medicine or the only things can help them from the allergy. So they are allowed to wear this silk. Also, to perform prayer without taking wudu as usual or tayammum in certain condition. So this exemption give for those who have some condition, there is one of the rukhsah. And then modification. Modification, you still need to do that prayer, that ibadah or that things, but we need to modify. We can modify. For example, position of prayer during lying and illness. The standard position, you need to standing, then rukuk and sujud and so on. But in some condition, when you are unable to move in certain movement, so you can change it. You can change it based on your condition, but and what you can do. This modification. The fourth is forgiveness, or is called prayers is excuse for women during menses. This dimaafkan, is called dimaafkan, or unconscious patient. So in Islam, we have rukhsah for women during menses. For example, so they do not need to perform prayers. Dimaafkan dan dijatuh, maknanya isqat ni tak perlu tinggalkan tu, or unconscious patient. And then the next type of rukhsah is replacement, ibdal. Example, tayammum is replacement of wudu in certain condition. And taqdim, prospective action. Same example for jamak prayer. Jamak prayer, for example, for those patient or healthcare personnel, which is their schedule to enter the operation theatre, for example, at 4 p.m. 4 p.m. And the operation may end at 7 or 8, about 4 hours. So they can do takdim, prospective action, takdim bersalah, jamak prayer. So they can do the Zuhur and Asar during Zuhur prayer time. This is mean takdim. And then reduction, tangkis, for example, prayers during illness. Same condition, maybe your movement is reduction during illness. You just lying down on your bed and do the salah. And do tayammum instead of wudu during illness. As we know, tayammum only your face and your hand until arm. But for wudu, you need to wash your leg and so on. But this reduction, when some condition, you just do tayammum, no need to do wudu, because it become worse to you if you perform the wudu. Now proceed to the application of rukhsah principle. The first rukhsah principle is not a general. This means it's not suitable for all conditions. It restricted to a particular situation and can be used for other conditions. And level of rukhsah based on level of darurah. So those who need to perform the prayer in sitting or lying down and so on, if level of darurah. And permissible rukhsah application have the limit, time, situation, and condition. It's not for all time. Then availing of rukhsah is based on actual situation, not on a presumptive condition arising in future. Must be an actual situation. Rukhsah is to remove hardship and not for enjoyment. not for enjoyment, not for exemptions, and so on. Is the objective is to remove the hardship and apply only when an alternative is not available. If you have the alternative, for example, you taking or you consume non-halal medicine, you have another alternative that's the same effective and halal. So why you use the non-halal? But if no other alternative, for example, you can. Then application option to avail a choice. In case of doctor, when they decide also or remark a certain situation, they can choose. They can choose to do as usual or take the rukhsah. Then certain rukhsah are compulsory. In some condition, compulsory during life-threatening situation, for example. So we need to do some rukhsah. Okay. And last but not least, only those have knowledge and full comprehension of Islam principle in decision making can apply the rukhsah principle. This is the first one, the ideal one. But otherwise, we shall ask other people with knowledge for advice. If we have knowledge, it's okay. But if we don't have any knowledge, we need to ask or to read and something to gain the knowledge about the rukhsah before we apply it. Otherwise kita akan sesat, kita akan ikut suka kita saja. Now we move to the last part of our discussion today is common issues related with fiqh ibadah among patients. Common issues. The first, there are too many issues about fiqh ibadah, but I just highlighted maybe 4 or 3 or 4 common issue at the ward and others hospital setting or settings. The first about ablution, wudu, and tayammum. The first is about patient with bandage at the face, head, hand, leg, and so on. How to take the wudu? Because all of this is wudu, part of wudu. We need to wash or we need to wipe it. So what I see based on my experience, my little experience, some patients, not all, tend to skip the prayer because when we ask, kenapa tak solat pakcik? Oh, ada balon. Kenapa tak solat pakcik? Ada granula, contohnya ada apa, sertip. Kenapa tak solat pakcik? Ni berbaloi ni macam nak solat. Dia prefer, jadi kita tanya, pakcik nak macam tak solat ke? They prefer to perform qada prayer after the discharge. Ni buat, mungkin boleh tanya lepas ni, tapi ini yang berdasarkan my little experience kita jumpa, sebagainya kita tanya, tak solat, salah faham. Is it the right way? Because as a Muslim, we need to perform prayer, 5 times prayer, in whatever situation, selagi mana kita hidup. Kalau mati, tak sedar, itu another story. Okay, we have 2 solutions. Needs just a summary, of solution. The first, for those who have bandage at the hand and so on, wash the healthy part as usual. Jadi basuh macam biasa tempat yang bersih and just wipe on the bandage part. Jadi tempat yang balut tu just sapukan saja and no need to repeat the prayers after bandage is removed and all become healthy. This opinion from one of the prominent scholar in Syafi'i, which is Imam Nawawi, and other mazhab opinion. So yang pertama ini yang kita boleh cadangkan kepada pesakit, basuh di healthy part biasa and just wipe on the bandage part. Jadi tempat yang berbalut tu hanya lap saja dan dia diterima sebab apa disebut dalam Al-Quran, fattakullah amastata'tum. Do fattakullah things kebaikan and so on based on what you can do. Mastata'tum, apa yang kamu mampu, apa yang kamu mampu saja. So this the first opinion. The second opinion, wash the healthy part as usual and just wipe on the bandage part, and then we need to do tayammum. Tayammum sebagai apa? As replace for the bandage part, because we can basuh with bandage So we do the tayammum. And after bandage is removed or become healthy, he need to repeat the prayer that we perform with the bandage and tayammum. It's an opinion from Mazhab Shafi'i. So we need to know roughly about the khilaf, the different opinion. So we can do, we can give the advice, the right advice to the patient. So what can I say? What can I advise? First, we can encourage patient to do the easier way, which is the first way. But give them freedom to choose whatever scholar opinion. Because as we know, Mazhab Shafi'i is our official mazhab, and some of patient, they have the knowledge and dia ada pegangan. So itu yang baik, lagi baik. Tapi siapa yang tak ada, yang tahu, memang kalau tak buat ni memang lagi sah kita solat. So kita encourage yang pertama, kalau tidak, kita give them freedom to choose whatever scholar opinion. Our aim is that patient perform the prayer. Itu our aim. Sebab apa yang paling banyak sekali skip solat. Jadi our aim, kita mudahkan, kita bagi pilihan yang ada. Sama ada kita nak bagi yang kedua, tayamum, kita sediakan alat tayamum. Tayamum tu if they need, we provide. Then kita advise, okay, apa lepas ni, apa what thing they need to do. Or we can advise the easier, the first opinion. So opinion from Imam Nawawi. So whatever, our aim is to ensure all the patient perform prayer during at the work. The second, patient with colostomy bag, continuous bladder drainage and so on. So some patient not perform the prayer because they thought they are with najis. Because we have colostomy bag and so on, CBD. So kenapa tak solat? Ni ada najis ni, menagur najis. It's a common answer. So what is solution? Okay, what we can advise them? First, you can perform the prayer. How to do? First, wait until the time of prayer. Tunggu sehingga masa waktu. Then clear the urine or feces inside the bag if possible. If not possible, it's okay. Fattakullah mastata'tum. And for those continuous bleeding, source of bleeding with bandage or pad or tissue and so on, then take wudu as soon as possible. After that, perform the prayer as usual as soon as possible. Whatever urine, feces or blood pass out for the moment of taking the wudu until the prayer are forgiven and the prayer is still there. It's very important. Apa salah faham selalu dalam solat. Sebenarnya benda ini dah difatwakan oleh JAKIM, dah keluarkan Muzakarah Fatwa Kebangsaan, JAKIM kata saya, dikeluarkan ini cara. So we follow. It's easier, dan we need to ensure all the patient perform the prayer. Then proceed to the next common issue is about the salah. Patient unable to move to perform the prayer with normal movement, standing, sitting, kneeling, sitting, and so on. Okay? So they tend to skip the prayer because they feel difficult, unable to perform with normal movement. Ini biasa kalau orang tua sebab tak solat, sebab mereka tak solat macam biasa, tak boleh berdiri, rasa tak khusyuk sebagainya. So they prefer to perform qada prayer. So what we can encourage them, what we can advise to them, is unable to stand, they are allowed to perform prayer on sitting position. If a patient neither able to stand or not sit, they can perform prayer on lying position. So benda ini kita boleh tahu dalam Islam kita ada flexibility, not a rigid. So ini memudahkan, dan yang penting after this they not need to qada or repeat the prayer. Sebab apa, bila sihat tak buat dah. Biasanya banyak duduk 1 week, 1 month and so on. Bila sihat memang kadang-kadang orang akan sakit sampai panjangan terus tinggal. Okay, this is another issue. Praise or salah. Patients with no relative accompany them, difficult to move, difficult to take wudu quickly. That if there are more movement, may worsen their conditions and not enough care personnel to help and entertain them for every prayer time. Tidak ada ahli keluarga, susah nak bergerak dan kalau banyak bergerak akan menyebabkan lagi teruk keadaannya. So kita selalu jumpa keadaan macam ni, patient. So apa kita punya advice, apa kita buat? First sekali, patient can perform prayer using method of jamak suri. What's mean jamak suri? Perform first prayer near end of prayer time and then perform the second prayer at the beginning of prayer time. Beginning of second prayer time. Kita tinggal second prayer time. For example, you perform Zuhur prayer at 4:15 PM and then perform Asar prayer at 4:35 PM with the same wudu. Jamak suri ni seakan-akan jamak tapi tidak jamak. All prayer, first and second prayer at their respective time. Prayer time masing-masing. Zuhur waktu dia, Asar waktu dia. Tapi kita lewatkan yang waktu pertama dan kita awalkan yang kedua. Jadi untuk for the 2 time of prayer, we just need 1 wudu. We just need movement, minimal movement. Instead of 2 movement, we need to ambil wudu dan sebagainya. Just 1 time. Very good. To do it. If not possible or difficult, patient also can perform prayer using method of jamak tamam with no qasar. Very important to emphasize because as a Muslim, kadang-kadang kita biasa jamak qasar. Term qasar which mean you make shorten, pendekkan waktu solat 4 jadi 2 is only permissible during safar, during journey only. But for the jamak tamam, you can do it more widely. For example, you need to entering the operation theater, you have in traffic jam and so on, you can do it, method of jamak tamam. So if not possible jamak suri, you have another choice which is jamak tamam with no qasar. No qasar. Either perform first and second prayer within first prayer time or perform second and third prayer, first and second prayer within second prayer time. Example, perform Zuhur and Asar prayer or Raka'ah plus Raka'ah within Zuhur prayer time, or perform Zuhur and Asar prayer Raka'ah plus Raka'ah within Asar prayer time. So I think the jamak is applicable not only for the patient, also for those who are involved in operation or any procedure, the long procedure, so you can do it. Instead of you qada lepas itu, no need to qada, you can do it. Even you do it delay, jamak ta'khir or session, which is mean jamak takdim, is permissible in Islam. Very important for the doctors to know first, then you can educate. If you tak faham, how can you educate others? Okay, the last one, in short, is about fasting. Fasting is a common issue. Some patients keep asking about procedures. They invalidate their fasting during Ramadan. Okay. Why they keep asking? Because of there are many scholar opinion on the thing that invalidate their fasting. For example, in Mazhab Syafi'i, any particle or object entering, inserting into any open cavity, such as mouth, eyes, and so on, so that invalidate the fasting. As we know, in medical procedure, there are too many procedures that involving inserting or introducing any open in any open cavity. But some contemporary fiqh scholars that think not invalidate the fasting if meet some characteristics. For example, not give not mengenyangkan, so on, not a food material and so on. So what is solution? First one, as a healthcare personnel, we need to identify the common procedure that may affect the fasting. Okay, then we need to have the knowledge about the scholar opinion. Educate patients about different opinion of scholars and give them freedom to choose whatever scholar opinion they believe. Because kita ada pandangan mazhab Syafi'i yang ketat sedikit dalam perkara ini, and then we have other some contemporary scholars, fiqh scholar yang mana mereka ini lebih terbuka dan banyak pembincangan dan sebagainya. So we give them a freedom to choose. This example yang kita boleh tengok banyak sangat procedure, just list of example, list of procedure. Mazhab Syafi'i kita tengok contohnya batal-batal, ada yang tak batal, dan kebanyakan sebagai ulama contemporary dan ada mazhab opinion batal sebagainya. Ini just for example. So bila kita tahu, bila kita nak educate the patient and so on, so mereka tahu dan mereka boleh pilih. Mereka boleh pilih yang mana yang mereka nak. If that procedure is not urgent, the best one is we can delay after the Ramadan, because we keluar pada khilaf, itu lebih baik, is better. But we need to do it in the Ramadan, so we can give them the choice whether to continue their fasting or to continue or to break their fast. It's about fasting. I think that's all, just some for example about the fiqh ibadah, medicine. Thank you.
Thank you very much, Ustaz Abdul Rahman. That's really interesting discussion. Ustaz not only discuss about the principles of fiqh in medicine, not only about the rules, but also the solutions. I think it's the practical solutions, and also learn a lot today. I have one question to Ustaz Abdul Rahman before I allow the other participants or the other committees to ask questions. I just would like to start the Q&A session now. Ustaz, we have learned just now about the rusah and also the solution for patients. Just wonder about a situation. I give an example to Ustaz. Let's say that a surgeon already prayed Zuhur during that time, and suddenly before Asar, the surgeons need to perform emergency operation, whereby it's important to save a patient's life, and it's expected that the surgery procedure would take quite a long time until reaching Maghrib. So during that Zuhur time, because he already prayed Zuhur, is there any solution or rusah so that the surgeon can avoid qada the asar, or he actually can just pray asar in Zuhur? What would be the option, Ustaz? Thank you.
First, the operation, expecting memang confirm ataupun dia kebiasaannya macam tu ke macam mana?
Kebiasaannya. So the usual
Okay.
the usual expectation would be usually would be quite long lah. So take quite hours. So how is it, Ustaz? Any solution to that or how?
Okay. Thank you, Dr. Saiful. So what can I suggest? I can suggest maybe they have another opinion about this, because we already know the actual time frame of the operation. Contohnya kita tahu dah lebih kurang lah, biasa buat dan sebagainya. So we can do solat asar before the zuhur. Tapi sama ada kita nak we need to merge together, gabung atau setiap solat zuhur, itu another opinion lah. Dia opinion. Jadi kalau kita nak keluar pada khilaf, kita boleh do the solat zuhur sekali lagi untuk kita jamakkan dengan asar, because our sahabah ataupun zaman Nabi dulu ada keadaan Nabi minta ada opinion untuk solat sekali lagi dipanggil i'adah, kita ulang solat the same time tapi untuk dapat pahala yang lebih banyak. For example, for those yang solat by individu, tak ada orang kat masjid, solat habis procedure macam tu, tak ada orang solat. Habis solat, tiba-tiba ada 2-3 orang klik datang, mereka solat jemaah. Jadi disyariatkan, disunatkan untuk solat again, solat sekali lagi untuk dapat pahala jemaah. Seperti juga tadi, sebab the first kita tak tahu pun bahawasanya akan ada emergency lepas ni kan. Jadi kita solat biasa zuhur. Kemudian kita tahu ada emergency case dan we have ample time to do the jamak prayer contohnya. So do the jamak prayer Zuhur dengan Asar untuk dapatkan pahala dan untuk validkan khidmat taklim Asar tadi. Ini yang buat akan boleh cadangkanlah. Dipanggil yang ada dapatkan pahala.
All right, thank you very much, Ustaz Abdul Rahman. I have one more question from the chat box. I read the question for all of us. Ustaz, for the situation of a patient incapable of taking wudu and perform prayer on their own, they can perform solah using method of jamak suri and tamam. What if in a case of someone being sent to old folks home in which the bathing toilet time is only once a day, in which the person is going to be put on pampers where they will pass urine and passing the BO for that day until it's time to change back their pampers that evening or Maghrib session. So there will be no proper cleaning of the genital part during changing session. The caretaker might be refused to adjust their timing of changing pampers or might refuse to help with their cleaning rituals. Can that person just perform prayers without proper cleaning of the genital part, I mean the pampers changing, at whatever time that is available? What is your opinion on that situation?
Firstly, wallahu alam, the best answer. But what can based on my knowledge lah yang kita share. Okay, pertama, the principle is fattaqullah mastata'tum. Kita bertakwa pada Allah setakat kita mampu. Based on what I understand from this situation, patient yang memang tak gerak dan tidak ada pilihan pada dia, maka dia solatlah keadaan yang dia ada saja. Dia saja, tidak ada masalah, itu saja, dan boleh dia walaupun ada najis, memang itu dia tidak boleh nak remove, unable to remove, and she or he will stay not for one day, maybe for a long time, sampai bila contohnya. Jadi memang takkan boleh nak qada. Jadi ketika itu dimaafkan. InsyaAllah Allah akan terima, ini saja yang dia mampu. Tapi kalau dia ada alternatif lain, lebih baiklah. Tapi if we have no other alternative, tadi prinsip kita ibadah Islam ni tidak membebankan. Dia have their own principle, but dia tidak yang sama, tidak membebankan. Jadi bila keadaan macam ni, apa yang kita boleh secara dululah kita buatkan advice. Keadaan ni memang tak ada orang nak tukar dan tak ada apa sebagainya, dan dia sendiri unable, sendiri tak boleh mampu nak bersihkan dia, maka dia solat setakat yang dia mampu. Tetapi kalau contohnya dia tahu, minta maaf, macam contoh dia tahu waktu tukarnya adalah petang, ataupun sekali. Jadi mungkin dia boleh lepas tukar baru dia solat zuhur dengan asar dalam keadaan yang bersih. Adapun bagi isyak yang mungkin tak boleh nak tukar, maka solatlah macam biasa. Jadi zuhur asar tu kita boleh adjust, we can adjust, boleh adjust lagi, maka kita jamakkanlah, paksa jamak, tapi waktu dah bersih. Adapun waktu lain maghrib, isyak, subuh tidak ada orang, maka tidak. Same issue kalau boleh share, kalau keadaan yang mungkin hampir sama tapi keadaan orang yang dipanggil waktu pakai PPE, musim COVID itu yang mana dia tak boleh ambil uduk, tak nak tayamum dan sebagainya, kita panggil orang yang faqidu taharain, dia tak boleh ambil uduk dulu. Jadi di keadaan macam ni, mengikut Imam Nawawi, maka kalaulah perkara ini tak berpanjangan, maka yang terbaik disolat dan ganti. Tapi kalau boleh ni memang tugasan dia, macam-macam keadaan yang selalu, so buat solat sakat itu yang boleh mampu, maka insyaAllah Allah akan terima. Wallahu a'lam.
Thank you very much, Ustaz Rahman Al-Azmi. If I can take a conclusion or take home message from this session is that whatever the situation is, we need to perform our obligations towards praying solar and also perform all the ibadah. We need to do the best that we can finding the solutions. If there's nothing that we can do, just perform as whatever condition that we have and try to avoid delaying it or qada it to the other time. Thank you very much, Ustaz Abdul Rahman Al-Azmi, for that wonderful session and discussion and sharing about the practical solutions for us medical doctors when we're facing patients, as well as when we're dealing with our own situation during ward and also doing our daily activities. Thank you very much, Ustaz Abdul Rahman. I hope this session will, inshallah, definitely will benefit all of us. I think that we can see that the number of participants is already increasing, so it's good for us to capture this memory, and I would like to announce that we would like to take a photo. We'd like to take a photo session, and I will pass this session for a while to Dr. Adil. Dr. Adil.
Okay, Assalamualaikum. Thank you, Dr. Saiful. So can we take a group photo, a quick one? So I hope everyone can switch on their cam. Okay, so take 3, 2, 1. Okay, second pin. 3, 2, 1. And the last pin. 3, 2, 1. Okay, thank you. Saiful, we can continue.
Yes, thank you very much, Dr. Adil, and I would like to thank to all the participants for still stay with us until this current time. So now we'll go to the next session, the second lecture series. I would like to proceed with the second topic. The next lecture title will be Overview of Principles of Tawheed in Clinical Practice, that will be delivered by Prof. Datuk Paduka Dr. Wan Azman bin Wan Ahmad. Prof. Dr. Wan Azman is the Honorary Professor in Medicine of University Malaya. He is currently the Senior Consultant Cardiologist and the Head of Laboratory Cardiology Unit of University Malaya Medical Center. He is an active clinical mentor in cardiology and is affiliated to numerous international and national professional boards. He is also an author of several National Clinical Practice Guidelines, CPG. He also has served as a consultant on several projects in his areas of expertise, cardiology and interventional cardiology, as well as develop the Islamic perspective of clinical medicine. Without further delay, I would like to invite Prof. Datuk Dr. Wan Azman for this session. Falyatafaddal mashkura, Prof.
Prof, we can't hear you, Prof.
Prof, can you speak once again, Prof. Datuk?
Hear me?
Yes, now we can hear you. Thank you, Prof. Datuk.
Thank you, Dr. Saiful, for your kind introduction. Professor Dr. Jamaluddin, the Dean of University Islam Antarabangsa, distinguished faculty, friends, colleagues, ladies and gentlemen. Assalamualaikum warahmatullahi ta'ala wabarakatuh. I have only left 45 minutes, I think, because my lecture is up to 11 o'clock. So this is a very big topic. 45 minutes may be not enough.
It's okay, Prof. We can extend that a little bit later. Yeah.
All right. Okay. So this is my topic: overview of the principle of Tawheed in clinical practice. Tawheed of faith is central to the teaching of Islam. Its conviction should be preserved during health and sickness, hardship and ease. The understanding of Tawheed in many circumstances shape Muslim seeking behavior and his or her purpose of life. The action of physician who practice Tawheed will be a source of hidayah and salvation for the other mankind. We know that Allah SWT is Rabbul Nas, Allah for the entire mankind. And Prophet Sallallahu Alaihi Wasallam is Kafatal Nas and Rahmatal Alamin, rahmat, a blessing for the entire mankind and human and creation of Allah SWT. And we, the Ummah Prophet Sallallahu Alaihi Wasallam, ukhrijan linnas, for what purpose? Ta'muruna bi ma'ruf wa tanhaw 'anil munkar. Because there's no prophet after Nabi Sallallahu Alaihi Wasallam. We are the deputy of Prophet Sallallahu Alaihi Wasallam, and the fikir and the word of Prophet Sallallahu Alaihi Wasallam should be our fikir and worry, and to save mankind from suffering, so that they can enter the paradise of Allah SWT. These are my lecture outline. What are the principles of Tawheed and its sources in Islam? Who should a Muslim take as the ultimate healer? What is meant by the principle of causality and ikhtiyar? And what is meant by the principle of qada and qadar and tawakkul? And how do the principle of causality, ikhtiyar and tawakkul influence health-seeking behavior? And how do the principle of qada and qadar affect the Muslim attitude towards health, illness, and death? So the first part is what are the principles of Tawheed and its sources in Islam. Tawheed, the Arabic term Tawheed, is used to describe this belief in the absolute oneness of Allah. Tawheed comes from an Arabic word meaning unification or oneness. It's a complex term with many depths of meaning in Islam. Muslims believe above all else that Allah is the sole divine deity who does not share his divinity with other partners. So the meaning of Tawheed, the knowledge and belief of the servant, his acknowledgement and his faith in Allah being singled out with every attribute of perfections. So this is concluded in the kalimah La ilaha illallah. La, that we deny there is no other God, there's no other deity except Allah. Only Allah is our God, is our Allah, who has the power of everything. And the belief there's no partner or like for him in his perfection. And we believe that our devotion, our worship, our servitude is only to Allah SWT, only to Allah SWT. And Allah has not created the jinn and mankind except to worship him alone. So what we have to understand, worship is not just our prayer, our salat, our fasting, our going for our zakat and going for Hajj. All our everyday life, every hours of our life, every minute of our life, every breath is all for the ibadah, for the worship of Allah SWT. We go to the hospital, we attend to our patient, we treat our patient, we talk to our patient. All these are ibadah to Allah SWT. So there are three traditional categories of Tawheed: the oneness of Allah, the oneness of worship, and the oneness of Allah's name. So this category overlap but help Muslims to understand and purify their faith and worship. Muslims believe that Allah caused all things to exist. All condition, all situation is determined by Allah SWT. So the deeper meaning, when to go to deeper meaning, Allah is our Khaliq. Allah is the creator. Allah creating all the creation in this world and this universe is be determined by Allah SWT. And Allah SWT have the knowledge of all his creation. For example, even the drop of rain, Allah have the knowledge where does the drop of rain go to, and who benefit from this drop of rain? The leaf from the tree. Allah decide, Allah determine that this leaf drop to which part of this earth, and how this leaf, the natural history of this leaf is all in the knowledge of Allah SWT. And Allah SWT provide razq, Allah provide the risk for all his creation of Allah SWT. It's mentioned by the scholars that even there was a blind snake. Allah SWT made arrangement for this blind snake. A bird every day come and feed the snake. So Allah SWT is the provider. Allah SWT is the razq. And Allah SWT is the takbir, regulating all the situation, all the condition in this world is takbir by Allah SWT. So if we remember the story of Ibrahim a.s. and Namrud, and you look at Ibrahim was ordered to take his wife Hajar and a small baby to Mecca. That time Mecca, there was no asbab for life. There's no mean for survival. There was not even a bird. There's not even no water, and there's not even a bird that survived Mecca at that time. And Hajar and Ismail as-Salam was left by Ibrahim as-Salam in that particular desert. And Hajar asked Ibrahim as-Salam, why you left us here without any sort of means for survival? And then Ibrahim does not answer to the question Hajar. And then Hajar understood. Then he said, is this the order of Allah SWT? Then Ibrahim a.s. just nodding his head. Then Hajar said, Hasbi Allah wa ni'mal wakil. If this is the order of Allah SWT, then Allah SWT will save us from all the destruction. So Allah SWT, who regulate, who do the takbir. And we look at Namrud, which have all the means. I mean, you know Namrud. We have all the means. He's the big king, one of the big king in this world. And Allah SWT just sent a small mosquito, that enter into the nostril of a Namrud and go into the brain of Namrud. And every time this mosquito bite the brain of Namrud, suck the blood from Namrud, he's having severe pain. And then Namrud ordered all the best physicians from his kingdom to treat or to relieve the pain, the suffering that is having. And they come to a conclusion. They come to a conclusion that every time Namrud had pain or been bitten by this mosquito, we had to hit the head of Namrud by a shoe. So Namrud will have his servant or slave be with him every time with a shoe, get ready to shoe, because it's unpredictable when this mosquito will bite or will suck the blood from the brain of Namrud. And every time when this mosquito suck the blood, he will be crying in pain, he'll be screaming in pain, and his servant will just hit on his head. So this pain become more severe, this pain become more frequent, and the hitting become more harder. So at one time, the slave have to hit so hard that the skull of Namrud just break open, and this small mosquito fly like a small bird. So this story, what Allah SWT will show that even in the abundance of means, but if Allah SWT decide to destroy a person, that person will be destroyed. So similarly, we have to understand that we are just an instrument of Allah SWT, just instrument of Allah. Even with abundance of means, even when the best or the high-notch hospital with all the best doctors, the best technology, but if Allah SWT decided not to put healing in that by that physician, then we will still not be able to get well. So Allah SWT, who regulate, who is our Khaliq, who is our Malik, and who is our Razik, who takbir, all this, the creation of Allah SWT. So yeah, then the other part is Asma wa Sifat, which is to affirm everything that Allah affirmed for himself, or his messenger Muhammad SAW affirmed for him, of beautiful names and whatever attributes by this name, without resembling or likening them to those of the creation, and without distorting them or denying them. And Tawheed Ibadah, that we do all our amal only and only for Allah SWT, sincerely for Allah SWT. Prophet ﷺ mentioned about a prostitute who was walking in the forest, and he saw a dog which is very thirsty. I think you know this story very well, being mentioned by many ustad this story well. And then she took the rope from the shoe and get the water out of the well and feed this dog. And due to this amal, he was forgiven by Allah SWT and made to enter Jannah. The scholars give three reasons why that small amal, insignificant amal by a prostitute was highly regarded by Allah SWT, was highly appreciated by Allah SWT. The first thing, this happened in the jungle. Happened in the jungle. No one see. Happened in the jungle. And this woman do the khidmat, just for the sake of Allah SWT, because he give khidmat to the dog. The dog can't be telling anyone else that this woman is a good woman who give water to me. If you give a khidmat, you give service to a VVIP, or maybe you will get promotion. If you give a khidmat to the ruler of the kingdom, maybe you'll be rewarded with datukship or whatever it is. Okay, but this woman give khidmat to a dog. The dog can't talk. The dog can't mention who has done a service to it. So this reason is basically want to highlight about the sincerity, the ikhlas, even a small amal, that this amal is greatly appreciated and greatly significant by Allah SWT because of the sincerity of this lady. So a servant cannot be a muwahhid, a truth monotheist, unless he holds fast to them and acts in accordance with them. So the source of Tawheed, I want just to mention Quran, the source of the Tawheed, and Hadith. Of course, ulama, ijma ulama and also the collective ulama. But people can be controversial nowadays about ulama. If I mention this is if I mention this Al-Ghazali, Imam Al-Ghazali, people nowadays, the PhD ulama may still question about who is Imam Ghazali, the authenticity of Imam Ghazali. Even same thing if I mention Ibn Sirin, or I happen to mention the ulama of Ibn Hajar, people will question. Okay, so because there are different sort of thinking, different school of thoughts. So enough to say that all the muktaba ulama, all the ulama that is have all the quality of ulama, then you can follow that ulama without mentioning which two of thoughts and which ulama here. So who should a Muslim take as the ultimate healer? So the saying of Prophet Ibrahim salam, which mentioned in the Holy Quran, wa iza maritu fahuwa yashfi, and when I am ill, it is He, Allah, who cures me. And so all the means for cure is in the treasure of Allah SWT, and it's only He who is able to give cure. And this story of Musa alayhi salam, this is a very famous story of Musa alayhi salam. And he was suffering a stomach pain. So he prayed to Allah SWT. You know that Musa alayhi salam, this got special sort of been given by Allah SWT to communicate with Allah SWT. Then Allah SWT ordered him to go to a particular tree and take the leaf of this tree. And then after that, he took this leaf and he was completely cured. And men always learn from experience, from the past experience. So at another occasion, he suffered the same pain, similar pain, the same type of pain. And from experience, he remembered that when he had this pain before, he went to this particular tree and took the leaf, and then he taken the leaf, and then he was relieved, the pain was relieved. So he went to this tree and took the leaf, but instead of the pain get relief, the pain increasing, become more. So he then complained to Allah SWT, asked Allah SWT why his illness was not cured, though he took the same remedy. What Allah SWT answered? Oh Musa, the first time when you were ill, you remembered me and asked for my help, and I granted you cure by putting shifa, putting cure in the leaf. However, this time you have forgotten me and have not asked me and not asked from me. Thus, I have taken away shifa from the same leaf. I mean, from our experience, many times, many occasions, we see patient got the same symptom, the same illness, the same diagnosis, been treated by the same doctor, by the same physician. One patient get well and recovered. One patient complication happened and something not right happened to that patient. We know this many times. So what's meant by the principle of causality and ikhtiar? So Prophet ﷺ commanded us to seek treatment. We have been commanded to seek treatment. Osman ibn Sharik said that some companion asked the Prophet, should we take any treatment in ailment? I mean, you know, the Sahabat, they have a highest state of iman, highest trust in Allah SWT. They came to Prophet ﷺ and asked, should we take any treatment in ailment? The Prophet said, yes, O servant of Allah, God has provided treatment and cure for every illness, but there is no cure for one ailment, and that is old age. This hadith from Tirmidhi Abu Dawud. The Prophet ﷺ advised companion to seek medical treatment and said, there's remedy for every malady, and when the right remedy is applied to the disease, it's cured with permission of Allah SWT. It's a very nice hadith. There's a remedy for every malady, and where the right remedy is applied to the disease, it's cured with the permission of Allah SWT. It's Allah SWT who gives the cure, who gives the shifa. And many times, even until this day, there are many diseases which we do not know the diagnosis. All right, that's why I call it idiopathic. For example, cardiomyopathy, heart failure, idiopathic cardiomyopathy. And we don't know what the cause of this cardiomyopathy, because of heart failure. Many rare diseases, we don't know what the cause of these rare diseases. Last week, I got a friend's wife who had a metastatic undifferentiated carcinoma of unknown origin. In PPN, 2 months been investigated, everything been done, all the scan, MRI, everything, you name it, all the blood tests, all the seen by 5 or 6 teams of doctors, oncology, physician, oncology, breast surgeon, or obstetric, even cannot find the primary. Cannot find the primary until now. And she passed away sadly. So Allah provides the cure for all disease. Abu Hurairah, who narrated, the Prophet ﷺ said, God has not created any disease which he has not provided a cure. God has not created any disease which he has not provided a cure. So this encouraged, enhanced for us to look for cure, for research to go on and to look for cure for some of the illness. All right. In other words, there is no incurable disease in this world except old age. What was thought incurable has become curable now. The Messenger of Allah SWT said, Allah never create a disease without providing a cure for it. The cure is known to some people and is unknown to others. Hadith Ahmad and Ibn Hibban. How do the principle of causality, ikhtiyar, and tawakkul influence health-seeking behavior? So Allah is great. Allah is great. Allah is omnipotent and omniscient. He has caused troubles, difficulties, and hardship on one hand, and caused the precautionary measures for them on the other. He has given help on one and ill help on the other hand. He has made disease as well as medicine and cure. The cure is known to some people and is unknown to others. He also loves to be called upon for help. So if you believe that Allah SWT provide cure for all illness, there's a remedy for every malady, then it instill hope and courage to our patient. Instill hope and courage. It gives positive attitude to overcome illness. Patients are better. We know that patients who are spiritual patients, they are better pain threshold. They are better coping with illness, pain, and life stresses. This also enhances recovery. Patients will not despair and rest the outcome in the path of Allah. Acceptance is easier. Accepted. They come to accept what Allah Ta'ala have determined for them. Acceptance. And accepting the highest status of man. Before we leave to Allah SWT, kita kena redha dengan takdir Allah SWT. And the grief period is shorter and patient have peace and solace. So we know that these stages of grieving and the last to get acceptance, if the grieving is longer, then it becomes pathological, and then this will not be good for the patients. So even when all means are exhausted, so we do not give up. We do not even give up. So we still taking the medicine, the name of Allah SWT. We still can make dua, reading the verses of the Quran, giving charity, avoiding prohibited things or existing the cure, and longing for the next life, and happy that we accepted and happy to meet his creator. So what's meant by the principle of qadar, and tawakkul? To believe in takdir. The Quran said, he is God most gracious. We have believed in him, and in him we put our trust. So believing in takdir means the belief that everything which happened is happening, and will happen is according to the knowledge, will, and command of Allah. This is called takdir. Allah says in the Quran, not of disaster before in the earth or in yourself, but it is in a book. We bring it into below. That's easy for Allah SWT. Allah Ta'ala ordered Salam in the Quran to say, O Muhammad, nothing can overtake us but that which Allah SWT has ordained for us. He is our Mawla, our Lord, our helper, our protector. And Allah, let the believers put their trust. Say, do you wait for us anything except one or two best things, martyrdom or victory? So if we are patient, then even things apparently doesn't look right for us, but we also get victory. So either two victory, either martyrdom or victory, the real victory. Surah At-Tawbah. Since Allah Ta'ala is our Lord and protecting friend, the servant should be pleased with whatever he chooses. This should be the condition of the servant. time and condition hardship prove beneficial to us in relation to the end result. So, in enduring sickness and hardship, ranks increase, sins are forgiven, and rewards are given. Thus, it matters not which condition we are in. Both conditions, with health and sickness, prosperity and adversity, are advantageous and beneficial for us. If the benefit of adversity do not manifest in this world, then for certainty, this will be manifested in the Akhirah. The Akhirah is our actual and original home and goodness, and benefit there will be our perpetual advantage. So the benefit of believing in Taqdir, the believer in Taqdir and Tawakkul or trust in Allah will be grateful or shukr in times and occasion of health, success, and prosperity. And he will be patient, sabar, when sickness, failure, and adversity overtake him. Thus, the man of Taqdir accepts what comes his way with contented resignation. He will not be overcome with frustration, become despondent, and lost hope when sickness or misfortune endures for any length of time. He will banish weaknesses. This is the great advantage which Allah Ta'ala points to in the following ayat. So that, Allah said, so that you do not lose hope over what you have lost, nor do you become elated because of what you have gained. Allah loves not all prideful boasters. Not that because we're able to treat less mainstream disease, patients survive cardiogenic shock. Oh, this is because, I go to IGN, I learn how to do angioplasty. Now I'm the best cardiologist. I can do angioplasty. I can open up left main. I can open up CTO. So that this is actually the blessing from Allah SWT. Allah SWT give me knowledge. Allah SWT give me expertise so that I can help the servant Allah SWT. So that with this expertise, I can be the source of guidance for the servant of Allah SWT. Allah Ta'ala says, whoever trusts Allah, he is sufficient for him. Hadrat Ibn Abbas, radhiyallahu narrates, I was once behind Nabi SAW when he said to me, "Oh son, I shall inform you of a few things. Remember Allah and he will protect you. Remember Allah and you will find him close to you. When you have to ask for something, ask from Allah Ta'ala. When you require aid, seek his aid. Believe firmly that if all the creation desire to benefit you in anything, they can never benefit you but that which Allah has decreed for you. So if all the physicians in this world gather together, want to help that person, want to treat that person, want to cure that illness, if Allah does not decide to put cure, he will not get cure, he will not get benefit. If they all unite to harm you, they will not be able to harm you in anything but that which Allah SWT decreed for you. This hadith is by Hadrat Ibn Abbas in Tirmidhi. Okay, this is very important. Believing in Taqdir does not mean discarding worldly means. So believing in Taqdir, don't misinterpret about believing in Taqdir. Believing in Taqdir does not mean discarding worldly means. The concept Taqdir should not be misconstrued. The essential, the correct ways and the means for worldly affairs should not be discarded on the pretext of resignation to Taqdir. When we are sick, discarding medicine or not taking as advice or avoiding going to doctor is not right. Discarding the lawful means and agency which Allah Ta'ala has created for worldly affairs is weakness as well as erroneous. Abdullah Prophet exhorted that one should harness the correct means for one case and activity. Harness the correct means. Go to the right person, the correct person. Not go to the ustad who say that this water can cure every illness. All right, go to the person who are expert in that particular field and get the correct mean, the correct right recommendation, and the what I call the evidence-based medicine treatment, so that you can get cured. However, if in spite of instituting the correct measure, the correct treatment, the correct course of action, failure result, then one would be justified in saying, sufficient for Allah, hasbi Allah, sufficient for me is Allah, and he's a good protector. So tawakkul is the whole reliance on Allah. Perfect trust in Allah SWT. Tawakkul does not envisage the abandonment of the lawful means. Understand this. Tawakkul does not envisage the abandonment of lawful means and agencies which Allah Ta'ala has created for the execution of activities. One to trust in Allah and not repose confidence in the means and ways. A resigned, carefree attitude, expecting a miraculous intervention. This is called delusion. This is called many times, many of these ustad and many of these so-called pious, not advised not to take any treatment, just we can make dua, we can just take in prayer water without any effort. Actually, this is delusion. This is delusion. Hadrat Abu Quzamah, who narrates that someone asked Rasulullah, do incantations and medicine alter takdir? If we take medicine, this alter takdir not? Rasulullah said, this too is included in takdir. Okay, so people ask, just to trust in Allah, then why do we need to take medicine? When why is it medicine? So Rasulullah said, this too, taking medicine also is a takdir. It's takdir. If you do not take medicine, it's your takdir. It's your takdir. So according to this hadith, the benefit which will result from medicine is also detected by takdir. So we should never become despondent, frustrated, lost hope, and displeased with what Allah has ordained for us in difficult situations. We put our trust only Allah Ta'ala and remains pleased with what He has ordained for us, even in the matter of sickness, health, life, or death. Oh Allah, leave me not alone. Thou art the best of protectors. So how the principle of qadar and qadar affect the Muslim attitude towards health, illness, and death? So this is a very famous hadith. So when Allah SWT want to give his bondsman a certain status, want to live into certain status, but it's no good amal, it's no very good amal, then Allah SWT inflict with some calamity his body to his wife or children, then grant him sabar or patience until he reaches that status which has been determined for him. The Jabir radiallahu anhu Rasulullah said, when the afflicted one are given reward on the day of Qiyamah, the judgment, the healthy one we wish that their skin were cut with scissors in the world. So when they see that all these people, sick people, were given reward because of the patient, and the people when they see the reward, how the state have been elevated, how much they have been given Allah Ta'ala, they wish that in the world they were given scissors so that to be cut, the skin to be cut, so that they can also have sabr and they also can get this reward. Anas narrates that I heard Nabi Sallam say, when I afflict my bondsman with his two beloved possession, he then exercised patience, sabr, I will grant him Jannah in lieu of it. His two eyes are meant here. Abu Sa'id narrates from Rasulullah, any Muslim that experiences any hardship, discomfort, worry, sorrow, grief, and distress, even a thorn prick, but Allah SWT will make an atonement for his sin. This is Bukhari, Muslim, and Mishkat. And Jabir report, Rasulullah said to Sarid radhiyallahu anha, do not curse fever, for it removes the sin of Bani Adam, in the manner that a furnace removes rust from iron. Mu'minin Aisha said, Rasulullah said, when the sins of bondsman increases, and he does not possess this, which we atone for it, Allah Ta'ala will afflict him with sorrow to expiate for those sins. And Anas report Rasulullah said, if a Muslim is afflicted with a bodily affliction or illness, it is instructed to the angel who record his pious deed, continue recording the pious deed. He committed his state of good health. If Allah grants him recuperation, he will cleanse him. If Allah grants him death, he will be forgiven and have mercy on him. So what should be our attitude toward illness? Then what should be our attitude toward illness? Just because something feels good does not necessarily mean it is of ultimate benefit to us. And conversely, simply because at the moment we seem to have pain, we cannot dismiss this experience as bad. Allah said in the Quran, there may be a thing decreed for you that you do not like that is good for you, and things that you like that are not good for you. Ibn al-Ghazali expresses this idea as follows. Illness is one of the forms of experience by which humans arrive at a knowledge of God. As he said, illness are my servant, which I attach to my chosen friend. Thus, we ought not necessarily to consider illness our enemy. Rather, we may see it as an event, an experience of the body that is serving to cleanse, purify, and balance us on the physical, emotional, mental, and spiritual plane. However, that does not mean we do not seek treatment or make any effort to find cure for our illness. For Allah provides cure for all diseases, and we have been commanded to seek treatment. So next 5 or 10 minutes, I just try to discuss briefly about the object of life and death. Allah, the Almighty, while expounding the philosophy of death, had commanded, He is He who has created Alladhi khalaqal mauta wal haya liyabluwakum ayyukum ahsanu amal. Allah Ta'ala created death, and then after that, life. Why Allah Ta'ala created life? To give a test, to determine who has the best amal in this world. So in other words, life and death have been created by Allah Ta'ala only with the object of testing your deeds and to witness who amongst you do the good deeds in the most perfect manner. That means to do deeds totally for Allah's sake and in accordance to the legal ways of Prophet Muhammad sallallahu alaihi wasallam. Every soul will taste of death, and ye will be paid on the day of resurrection. Only that which ye have fairly earned, whose is removed from the fire of hell and is made to enter paradise or Jannah, he indeed is fearful. The life of this world is but comfort of illusions. So the life of this world is just described as an illusion, as a play and amusement. So this all the verse of the Quran, and the life of this world is nothing but play and amusement. But far better is the house in the hereafter for those who are pious. We not then understand. And this life in the world is only amusement and play. Verily, the home of hereafter, there is the life indeed, if they but knew. So the truth of death. Death does not mean the ultimate end. It's not the end. It's not the end of the life. It's just a break of the relationship between the soul and the body. And it's a transfer of soul from one place to another. What will perish only the body that we do not need anymore. The body, the liver which has been cirrhotic, the heart which already had cardiomegaly, right? The kidney which is already failing. So we don't need this body anymore. The soul is created to live forever. Death is beginning. It's a beginning of an everlasting life. So the fear of death is always, we can understand the fear of death. I mean, I'm not going to elaborate this further. When a baby come out from the mother, have you ever heard that the body laugh? We have not heard this. Okay, every baby that come out from the womb of the mother, the baby will cry. Why does the baby cry? What is the reason? Physiologically, your pediatrician would say that it's to expand the lung. That's why the baby cry. It's to expand the lung. Okay, because now baby before that was using umbilical cord for its nutrition. Now it's breathing the air to expand the lung. But even if the baby laugh, that also can expand the lung. So the reason why baby crying, because he's crying because fear for this world, because he don't realize what will happen. What will happen when he come out from this world? The last 9 months he was in the womb of the mother. That was his life. He thought that was his only life in the womb, depending only on the umbilical of the mother. He can only swim in the womb of the mother. But he does not understand the vastness of this world. The vastness of this world. The nikmat, the beauty of this world. He does not understand the vastness, the beauty of this world. That's why he's crying. His fear to go to and come to this world. So similarly, we have that fear. Everyone got the fear of death. Okay, we have to admit that. That's a reality of fear of death. Because we do not understand what will happen to us after death. We cannot apprehend the vastness of the life hereafter. What will be the life of hereafter? That's why the fear of dying. There's a fear of dying. So this is the meaning of death. Death is simply a shading of the physical body, like the butterfly coming out of a cocoon. It's a transition into a higher state of consciousness where you continue to perceive, to understand, to laugh, to be able to grow. And the only thing you lost is something that you don't need anymore. That's your physical body. Okay, we are in the 70s, 60s, 70s. You don't need that physical body in the life after. That's what you lost. But your ruh will continue, will be in the life after. It's like putting away your raincoat when spring comes. That's what death. So do not welcome death with sorrow. Laborer, be happy when you are released from work. So actually, death releases you from all this pain, from all the suffering, relieve you from all the burden of this world. Your grief shall turn into joy when thou shall sleep in peace. So we sleep in peace in the grave. The dead have such comfort and peace that they did not want to rise again. So one thing that I want to mention, that this healing, that you're in this profession, is a great profession. It's a profession of great people in the past, and you'll be given a great trust. There's a life of man. Whoever is connected with this profession is greatly rewarded and honored. There's no other human act more favorably accepted to Allah than helping the sick and suffering creation of His. So good doctors not only cure illness, do we really connect with our patient? Do we understand their situation, their hopes, and their fears? If we do not, then we do not understand the unique spirit of our patient. Without this connection, patient become just cases and disease and caregiver, and the caregiver get burnt out. Okay, so they don't have that satisfaction. All right, it's just looking at the coronary artery. It just due to the oculosynotic reflex, they just put the wire, put the balloon, dilate, and put a stent. That's all. Without seeing the patient, talking to the patient, communicating to the patient, explaining to the patient. After that, this becomes just like a case, like a normal case. They don't see any sort of happiness or satisfaction in the job. Then they get really overstressed, get really burnt out, and then with that. So happy patient find meaning in their suffering. I think if you understand this, we can be able to give compassionate care to work with patient in the midst of their pain to their partners rather than expect to take information to them. So I just going through this, find meaning. Also, we have to find meaning in our profession. Who knows, in this process, we may just find meaning in our life and in our own profession. So we understand what is the purpose of we are here and what the purpose we are in this profession. So our role, Allah mentioned in this holy verse, come back to, Ya ayyatan nafsul mutmainnah, irji'i ila rabbika radiyatan mardiyah, fadkhuli fi ibadi wadkhuli jannati. So come back though to dialogue with where pleased thyself and where pleasing to him, so that his servant is pleased with Allah SWT. And Allah SWT be pleased with him. When a person is pleased with Allah and pleased to go to Allah SWT and pleased to meet Allah SWT, Allah SWT will be pleased with him. When Allah SWT is pleased with him, then Allah SWT say, enter though then among my devotees, yea, enter though my heaven. In whatever way we live this mortal world, in the very same manner we'll be raised in the life after. So the best way to live this world is the readiness to meet his or her creator. So our role is to create this readiness so that patient will be able to accept whatever been determined by his Lord, by Allah SWT, so that they'll be happy to meet his creator and the creator be happy to meet him. So the life of person is measured not with the years, but with the footprint that he leaves in other people's life, thoughts, and heart. Thank you for your attention.
Alhamdulillah, thank you very much, Prof. Datuk Wan Azman, for that wonderful, energetic, magnificent reminders regarding Tawheed principles in clinical practice. Prof have enlightened us and highlighted about the important points about having trust in Allah, believing in Taqdir, and being humble, show a good characters and sincere in our clinical practice, regardless of our position in our field. Can we have a short Q&A session, Prof. Datuk?
Can we can have until 11 o'clock.
All right, sure, Prof. All right,
I start about 7 minutes for discussion.
Thank you. I start one question, Prof, before the others would like to ask. We know that in clinical practice, sometimes we might face a patient or family members actually against evidence-based medicines, and sometimes when we're talking about getting consent, we cannot run away from talking about the risk of mortality and morbidity, and that's why sometimes they do not want to proceed with a certain procedure or intervention, and they sometimes using a religious reason for that. So from your point of view and your expert opinion, how actually we can not defend but can convince them from religious point of view as well, so that they can actually agree to disagree to proceed with the intervention, Prof.
The key thing, okay, the key thing is that you must create a trust. There must be a trust between patient and doctors, or the physician looking at the patient. Most of the time, this connection has not been created. Okay, not been created. And most of the time, doctors come and tell the patient, just sign this form, without first establishing that connection, that relationship, without creating that confidence and trust. If the patient has trust and confidence in your management, I don't see any issue. I don't see any issue why patient refuse your recommendation or your treatment. The reason they refuse is that there's lack of trust. There's a lack of trust. And we always have to balance between the benefit and risk. Benefit and risk. Okay. If the benefit of the procedure outweigh the risk, we explain to the patient in a manner that is easy to be understand the patient. Most of the indicated patient, all right, will be consent, will give the consent for whatever treatment that you have recommended to them. Okay, if they refuse, I think there's a lack of trust, and or there is some miscommunication somewhere.
All right, thank you very much, Prof. Dr. Wan. Any question from the participants and also committee members or lecturers? We are really honored to have Prof. Dato here, so I hope that we can use this session usefully to get interaction with Prof. You may also unmute yourself and can proceed with the question directly to Prof. Dato Wan Azman. Any question from the audience and participants?
Prof. Azman.
Yes.
Assalamualaikum. I'm Amin. I'm actually a lecturer. Prof, I want to ask your opinion and maybe everybody else regarding when we encounter patient who is like in the palliative stage but still have time but terminal. Prof, have any experience or advice to all of us? Because when you presented the death part is so nice. That we as a doctor to have better
I'm not sure whether you have read my book or not. Welcome in the most precious moment of my life. That book I wrote about 25 years ago when I still was a lecturer at the time, and there was no palliative care specialty in medicine at that time. There was no specialty. There's no palliative specialty in medicine. And that book, one of our students from UM, he was doing a master in rehabilitation. He brought that book to Stanford University, US. So one of the professors at Stanford wrote back to me, emailed to me, whether he can use some of the chapter that I wrote in that book for his palliative care medicine or for his terminal ill patient. I said, you're welcome to use whatever, and no need to pay any honorarium to me. So about 25 years ago, I used to give that book to all my patients who are terminal, who are near end of life, okay, who are in the stage 4 failure, not much to be done, and so on. And many of them found very useful. But now you got palliative care in our PPM. Now we got palliative care specialty, and most of these patients be referred to the palliative care physician to take care after the end stage. Okay. In fact, has been written very nicely about the etiquette at the end of etiquette of death or etiquette near the end of life, which Prophet Sallam have showed to us. And the time is very short for me to go through. But if you have opportunity to find that book, I've not printed. I mean, people want, then I can stick about 50 or 100 more books left. So it's not in the bookshop lah. So you can, I can send to you, just give me the address, I can send to you. You want to look at that. I think there's also many people have already written some aspect of that etiquette at the time of death, or looking after terminally ill patient, what needs to be done. So the key thing I mentioned to you, the key thing, most of these patients have who undergo grief period when say that, you already got stage 4 cancer. or there's no more treatment. You're not respond. Do not respond to the last sort of the third line of care, the third line of treatment. Then they will become very grave. They become very depressed, or they become denial. Okay, they become instead of denial, state of depressed. So we want to shorten this grief period, so that they become accepted. They become accepted, rather. They become accepted. And one of the patient, one of my patients, I still remember him very well. Just came back from US, got PhD, and suddenly got CA lung with stage 4, CA lung. But to cut short, he survived over 3 years. Managed to go to Mecca to perform his Hajj. Managed to go to Mecca. The physician told him that he got only 3 months to live, but he survived 3 years. And the last part of his life, he said, don't give morphine to me. Don't give morphine. Don't intubate to me. I want to be alert. I want to be with my wife and to see my children. And he passed away in the kalimah la ilaha illallah. I can hear that he passed that. And until now, his wife and never married, and all the children went to university. The wife take care after the children very well. So this is our, and one of my patients, he's not a Muslim patient. His husband went to Japan and went to seek the priest in Japan to ask for medicine, because he was told that this priest is a very powerful priest who can cure him. And every time he pain, there's certain sort of dua that I was a medical, just a medical officer at that time. So the only thing that I can do at that time, because I do not have much sort of knowledge of medicine, is to recite some dua. And somehow, by the grace of Allah SWT, his pain relief. And every time, I was not in that ward after 2-3 months, I was not in that ward anymore. Then every time he got pain, he told the lecturer of that ward, go and find that doctor who has that kopiah to come and help him. Because there's no more things able to relieve his pain. It's only the power of dua that Allah SWT, the grace of Allah, that's able to relieve pain. So there's you want to look that there will be a guide for you how to take care of the terminal patient or patient who are already there's no sort of medically there's not much that can be done, but the key thing is to make the patient in a sort of giving strong courage, hope, and acceptance by the way of Allah SWT.
Thank you very much, Prof. Dato' Wan, for that answer, and thank you, Dr. Salmani, for that question. I think we have one last question, Prof, from the chat box, from Dr. Zulfadli from ONG department. Dear Prof, how do we counsel patient or family member who believes getting medications or treatment is only harus but not wajib?
Of course, the compulsory, well, if that save life, I would say that it's wajib for you to take that treatment, to seek that treatment, save life. All right. And a person who know that that treatment is been already class 1 recommendation. You know what is class 1 recommendation with great level A evidence. That means strong recommendation should be given. And there are many RCT trials to show the evidence. Many RCT trials and a mass control trial, to show the evidence, the class 1 recommendation. And that person refused to take. And that is the only sort of guided treatment that can save life. If they refuse to take, then I think that is erroneous and that is wrong. That is a sort of understanding about Islam. That's why I say just now, a person, there are many people who say, no, I already take alternative treatment. This is one of the, what you call denial, and some people, just to comfort him, why you do not take Western medicine? Oh no, doctor, I'm taking alternative treatment. What treatment you take? I tawa alternative treatment. And just I already asked Ustaz to do Salatul Hajat, and so this is called delusion. That's what I said just now. It's a delusion. People who make this type of tawakkul. Right? You are not at the level of that pious where your dua is directly go into the acceptable makbuliyat, that state of makbuliyat, and you just say that, oh, I just made dua, and just hoping for miracle to happen, working for miracle, hoping for miracle to happen. This is delusion. Understand that?
Thank you very much, Prof. Dr. Wan Azman Wan Ahmad, and to all the participants who have asked questions just now. I think we've come to the end of this talk session by Prof. Dr. Wan Azman. Anyone to like to ask question? Prof. Amin, any question? Prof. Amin, no?
I don't have a question. Assalamualaikum, Prof. Wan. So long don't see you. It's our Sifu talking. It's a very good, humble talking in terms of the Tawheed in terms of for the patients, which is I like it very much. We do practice it in the hospital. In terms of the terminal ill patient, as well as the communication with the patient in whatever you write in the book. I love the books, but I think I lost the book already. I think maybe around 10 years ago, I read the book. Okay, thank you. I don't have very much question, but that is a good to have Prof. Wan Azman with us, and I think we should call him again and again to remind us what we are supposed to be doing with the term of the patient and deal with our communication.
Inshallah. Thank you. Thank you very much, Prof. Amin.
Okay, so thank you for having me. Okay, take care.
Thank you very much,
It's
Prof.
great to
Dr.
like.
Wan Azman.
Okay,
Thank you. Alhamdulillah. So that's the lectures from Prof. Dr. Wan Azman Wan Ahmad, our cardiologist and honorary professor from University of Malaya. So I think what the take-home message that we can learn from him just now is that having trust in Allah and having beliefs in tawakkul and takdir does not mean that we don't do anything. Dua is one of our important remarks that we need to do in doing the best in our life, but also means that we need to do some actions and do the best intervention that we can have and we can give to the patients in order to save their lives. Now we're going to have a short break, a 5-minute short break before we get to the next session. But before that, I would like to share a poll to all participants so that you guys can answer this poll, these questions, before we proceed to the next session by Prof. Dr. Amin. So I hope everyone can answer these polls. And inshallah, with that, we're going to have a short 5-minute break before we proceed to the next session. Thank you very much. Assalamualaikum and a very good day to all participants and beloved speakers. Assalamualaikum and a very good day once again. Inshallah, before we proceed to the next session, I just would like to share about the results of the polls just now. So from 80 participants that participated in the polls, for the first question, Islamic input in clinical practice is best displayed by doctors through majority, almost 84% of the participant choose his good characters toward his patient and staff. 11% answer reminding all patients about religious duty, and 5% answer prioritize solat even during emergency surgery. Second question, by being a medical professional, the doctors will, so all the participants agree that to perform his clinical duty ethically. And the last question is clinical decision making is made for the best interest of majority answer for patient, the best interest of patients. All right, Alhamdulillah. Now we come to the second lecture series for today's event. Now we'll proceed to the lecture title, Overview of Fiqh Muamalah in Clinical Practice, which will be delivered by Prof. Dr. Amiruddin bin Cik Ahmad. Prof. Amiruddin bin Cik Ahmad is the Senior Orthopedic Consultant in our hospital and also university. He's currently the Head of Sharia Compliance Department of Sultan Haji Ahmad Shah Medical Center, Islamic. He's among the pioneer in IIMP, especially in postgraduate training in medical curriculum, and also among the champion of the previous IIMP coordinator in our university. With that, I would like to invite Prof. Amin for this session. Prof. Amin, falyatafadhal mashkura.
A'udzubillahi minasyaitonir rajim. Bismillahirrahmanirrahim. Alhamdulillah Rabbil Alamin, wassalatu wassalamu ala asrafil anbiya wal mursalin wa ala alihi wa sahbihi ajma'in. Allahumma salli ala Muhammad wa ala ali Muhammad, amma ba'd. Can you all hear me nicely?
Yes, Prof.
Is it good volume? Sorry, I have a sore throat. Maybe I have to stop earlier or take a drink or something. But inshallah, I'll try my best to cover the topics on the fiqh muamalah in medical practice. So we focus on the medical practice. This is just an overview in which you have to touch a bit there and there, because as we know that the muamalah actually is a very big topic in Islam itself, which is if we can categorize it in the fiqh or in the Sharia, there will be muamalah is a part of a big portion of it. And under the muamalah, if you certain scholar, they will include the munakahat, the transaction, I mean the monetary transaction, about the sasiyah, everything is under munakahat as well. But in certain scholars, certain Islamic scholar previously, especially the fuqaha, they will divide in further muamalah, fiqh to more details. And then muamalah is some sort of they're putting in the more of a financial transaction rather than in the general term of muamalah, which is a interrelation between a human being. Okay, in our short discussion today, we are going to discuss about the fiqh muamalah. I think Ustaz Abdurrahman already mentioned a bit of a definition. We just focus on what we want in terms of the medical practice. And then we are going to discuss about more towards the interaction between doctors, patient, about the informed consent, shared medical decision making, a bit of a communication issue, because this is the paramount important things that usually we are discussing when it comes to the doctor-patient relationship. And then I will touch a bit on spiritual care support, which is I think is important to be embedded as well as to be merged together with our clinical practice nowadays. And at the end, I will touch a bit of the Sharia-based healthcare, which is I think this is an important concept that we have Now, in terms of the how to make sure that whatever we learn, whatever we do is within the framework of the Sharia, which is we can understand that the value that we have in Islam, which is universal and then is acceptable for everybody's. With the concept of our rahmatan lil alamin, means that memberi rahmat kepada seluruh alam, dan juga not only limited to the Muslim but also for the Muslim. We are discussing a bit of how we are going to do with the gender interaction or aurah, as well as a bit on role of wakaf, zakat, donation in healthcare, especially what we are practicing in our own hospital, inshallah. In terms of a definition, the fiqh means a deep understanding, means that we have to really go, and then the person who are having this deep understanding is the fuqaha, which is their faqih, and there are also jurists, which is they know is exactly. For us, we are rakyat marhain, we are the ordinary people. We have to learn to make sure that we are not following this fiqh, this is understanding with the taklid, just ikut babi buta, but we need to understand it, especially for the practical ruling in the Sharia. Okay, muamalah means a lot of meaning of muamalah, but in terms of literally, it can be a treatment, dealing, social intercourse, conduct, behavior, business, any transaction, relation. This is a whole scope of muamalah, which is going to be very, very big. Then that's the reason why, for the medical purpose, a lot of muamalah is basically what you call, we are discussing in terms of relation, social intercourse, as well as transaction of people between each other. This is a thing that we are going to bring the concept, because if you are talking about kalau kita dengar bank muamalah means that we know already this is something like the monetary transaction. Okay, but this is not only the concept of a muamalah in Islam, but they have a bigger scope. But for the medical purpose, we are concentrating mainly of the interaction, as well as how we deal with the human being, how we deal with the patient, doctor-patient relationship. And then this, when come to these two major section of the fiqh that we are talking about, either ibadah or muamalah, and then we are concentrating, I will cover a bit of the muamalah in terms of the concept, the scope that we are defined just now. Okay, we are talking about the doctor-patient relationship. This is important for us. One thing is we need to understand what is the patient right. Patient come to see us. Whenever patient to come to see us in our hospital, most of the time, whenever patient registered in the hospital, they have to agree certain contract as a patient. Means they have to sign something like kita panggil term and condition of the patient, in which they have a right, what is their right, and then what is the hospital right, what is a doctor's right. So they must be clear from beginning. That is what the fiqh means. We have to really understand, and then must be something which is not ghara, it's not something which is very clear. Okay. Second thing is privacy. And then patient always need to be informed on advantage and potential risk of treatment, any treatment that we are giving to the patient. Any even simple things as such as we want to take the blood of patient, but patient have to understand that. Okay, patient also have a right to refuse the treatment. Not only receiving treatment in the hospital, but they have right to refuse the treatment, even though patient was given patient is undergoing appendectomy. Okay, up to level of before the induction given to the patient. If patient says suddenly they say I don't want the surgery, so we can't really proceed because that is a right of the patient. This is a refusal part is actually is the patient right. Okay, then right of a confidentiality must be patient should have the privilege of good communication with the our side in the hospital side, physician, doctors, nurses, everything, whoever deal with the patient. That's the main reason why this is so important to deal with so-called proper management of the patient started with the proper communication. Okay, patient expected from the doctors, they want to cure of the disease, and the second thing they want to be listened. What is their things, the feeling that they have. This is going to be part that we are going to discuss a bit more in terms of the spiritual care. What is our responsibility as a doctors? We have a freedom of a choice. We are the elements in the hospital, which is have a many responsibility. We are responsible to improve the community by giving the proper treatment. And then we are responsible for the patient, which is very important, because what is our client? Our client is a patient. Okay, must support the access to the medical care for all people. There is no different. Okay, then we have to take care of human dignity. We must be honest. Amanah is a part of our responsibility. Not only amanah in terms of managing patient, but also amanah in terms of keep the confidentiality of the patient. No, not necessarily. We can't really discuss the patient condition with everybody. Unless this is a medical personnel, which is really need to know that. Not everybody. Okay, responsibility of a society, like says committee just now. We have to take care of the confidentiality. Then the last one, we have to continue study to improve ourselves. Don't stop study, even you are the consultant already, or you are the specialist already, you are the senior registrar already. Never stop study, because this responsibility, because we need to address the up-to-date, we are not to make sure that the facts that we give to the patient regarding the diagnosis, treatments, everything must be up to date, and then must be very clear. Okay, the doctor-patient relationship. Okay, doctor-patient is not a case. Okay, it's not the any other admission or patient are not disease. We have to treat patient as a person. Okay, the person which is receiving registered to receive a medical treatment. Patient is the person who are giving their right to be observed by the doctors. Okay, so this is the things that we have to understand about the even they come with a physical complaint, but we have to also look at their emotional. You have to look at their barulah kita punya treatment to holistic in nature, rather than just treating the disease, just treating the case. Okay. Then the consultation. The consultation is the part where the doctor-patient relationship. Okay, they will have to be most of the time the physical meeting. Now musim-musim sekarang kita banyak guna online apa semua. There is no, when we do we do consultation of the patient, there must be actually is a physical meeting rather than online. But now people changing because of their technology. There will be a lot more changing. Maybe the consultation can be done with the online ataupun telemedicine whatsoever. But still, when come to the relationship, the human touch, it must be the physical meeting. Okay, so this consultation aim to understand the task of understanding the patient. One, okay, it's must, we need to understand the patient. And the second thing, we have to understand their problem. Okay, so we not only just want to understand their problem, but we also have to understand the patient as well. Meaning that we have to really, when we clock the patient, we discuss with the patient, we know the background of the patient, make sure we know it's by heart, so that we can proceed We can be more empathy rather than just sympathy of the patient. Ideal relation according to the Islamic perspective, we must be justice. Okay, not only the amanah we talk about, we must be justice among our patient. Sometimes we are looking at the patient, among other patients. Sometimes we like to treat one group of patient, but we ignore another part of patient. Okay, which is it shouldn't be. Okay, be ihsan toward the patient, which is to be good, tolerant, sympathetic, forgiving, polite, and cooperation. And the politeness is very important as a doctors, whatever level it is. We become specialists, we become, whenever we have become consultant, whenever we deal with the patient, our tone must be accordingly appropriate. Polite, as such, the patient is our relative. We talk to them in a polite manners. In not only the patient, but also among our colleagues, to our colleagues, when we're talking to each other, referral cases, everything must be polite, must be informative, must be actually have a give and take. That is a part of our relationship as well. And then we doctor must provide good treatment for the patient as well as a patient relatives. This is difficult to deal with a relative or the patient. Difficult. Sometimes satu kampung datang jumpa doctors, we should have kita panggil family conference with the patient. This is something which you need a skill for us to deal, especially when you become specialist, when you become consultant, you have to know how to deal with it. Another thing is the rahmatan lil alamin, that as last that we mentioned just now. Okay, there are few styles that we are discussing about the doctor-patient relationship. The first one is doctor-centered style, or we call it certain books or person in their old principle of the doctor-patient relationship mentioned about the paternalism ataupun paternalistic doctor. This is a traditional way in which dulu doctor is the king. So whatever doctor mentioned have to follow, and then there is no question about it. When a consultant mentions something, nobody actually is a question. The patient cannot say no. The patient have to follow. That is a doctor-centered style. Okay, this is tightly controlled interview style, aim to reach an organic or diagnosis. Some nothing to do with kita panggil is personal growth, or we call it the spiritual growth. There is none. There is only doctors mention it. The second one is opposite that. It's a patient control style. What is a patient control style? This is a patient control consultation. I'm sure that you have experienced. Doctor come and then he said, when patient come to you, they mention, doctor, saya nak ni apa semua. That you have to follow whatever this one. There is things happen. You have to pay to do what I tell you. Especially dekat private lah kan. Whenever in the private, that is we have to follow whatever patient want. I mean, as long as a patient have justice, or maybe this is not it's not the indicated, but the patient want it, we have to follow. Because patient pay for it. That is something which is dangerous here, because doctor become passive. There is no such thing as a good communication. It's imbalance. Okay, this is another patient control style. Another one is a patient also, but we call it patient-centered style. Okay, this is a balance between the patient and doctors. It's less authoritarian, and then the patient was encouraged to their own feeling, concern, open questioning. Okay, they are concerned lebih kepada psychosocial aspect of illness as well, not only the organic illness ataupun physical illness, but also other things. And then the doctors have to be active listening, not only listening, not only passive, but they have to have the interaction, good communication. There will be a lot of things that can happen in this part. Okay, and then patient-centered clinical interview doctor shown by the proper way that we are doing, taking history, physical examination, investigation, everything, and then we are considering the ideal concern about patient expectation, and they will result in an understanding of a patient belief, and then this will have a better result in terms of the doctor's-patient relationship. Okay. The only problem with this one, whenever you want to do this patient-centered style, it will take longer time, because the study shows usual patient-doctor interaction is about 8 minutes, from 2 minutes or maybe less than that, or to 20 minutes, but in average about 8 minutes. So make it difficult for us to implement that patient-centered style. But more and more, especially in terms of a specialist level, consultant level, they can able to practice how to do the patient-centered style. Okay, we're talking about the shared decision and informed consent. This is related to that patient-centered care, patient-centered approach or style that we use. Patient consent treatment is considered essential step of the proceeding for the process of providing medical care. Okay, so the first thing, patient is well informed, the possibility of the benefit, complication, and then side effect must be explained as well. Then this is the part of whenever we have the active listening, active discussion, the part of responsibility of doctor or amanah toward the patient is directly influencing the patient to be biased to choose any option that personally liked by the doctors. Okay, this is not something which is involuntary, but because of that one, we are influencer. That important for us actually is to tell the patient what is our opinion regarding this. Okay, the patient opinion and background details should always be considered in terms of managing decision. Ask the patient what is their expectation. If let's say we do this kind of the management for you, are you agree on that, or anything that maybe you want to add? This is a decision making that is involving the patient as well. Okay, we talk a bit of the patient consent. Permission for something to happen or agreement to do something. The medical consent is different. This involves the patient providing permission, consent for treatment or investigation. That is very clear. Gaining consent is the ethical and legal requirement of doctors. When want to do the surgery, the person who are going to do the surgery is the person who are supposed to take the consent. Okay, what is the type of consent that we are talking about? There are few. Okay, written consent, which is the most legally substantial. Okay, or we have the verbal consent and the implied consent. This is the least illegal. Implied consent, for example, you want to take blood. Okay, you want to take blood the patient. Okay, you don't spend half an hour to explain what is how we do, we call apa ataupun for example, lagi mudahnya kita nak ambil BP kan, ambil BP nak check temperature. What we don't really spend half an hour discuss of what is complication, what is because there is something which is common. But there is a problem with the implied consent. The doctors take it for granted. So sometimes they go to see the patient bed, then patient know already, you see that patient holding the string dengan needle whatsoever. Patient lying down and then put the hand like that already. They know already want to take the blood. So doctor without taking anything, we talk to the patient, terus go and take the blood apa semua. Sometimes the patient don't know they are right as well. Okay, so doctors, they shouldn't do the implied consent so much. At least you get the verbal consent. Make sure you explain a bit what you are going to do, and then only you do when the patient consented. Okay, must be consented. Written consent actually is very simple. This must be something you written, you explain, you have to do everything, you have to explain the consequences, side effect whatsoever, and then patient sign, you have to sign, they got witness as well. Okay, what is, we call it a valid consent. The following criteria, there is 3 criteria that we need to fulfill. The patient must be fully informed. I'm talking about how do we inform the patient. Patient must be competent. There are criteria for the competency of the patient. One is the age, Second is patient is aware what we are doing. Means patient is mentally sound, and then patient is fully conscious. That is the important part, which is I'm not going to discuss very detailed in terms of this competency. But the third one is must be voluntary. No such thing as a patient are forced to do, kena paksa, sign apa semua, nak buat apa semua. This is a dictatorship. It's not a valid consent. Informed consent, there has to be a few criteria that for informed consent. The nature of treatment being proposed, why is it needed, means that its indication must be clear. Jangan kita buat apa semua. Memang kita nak buat macam ortopedik, dia nak buat arthroscopic surgery, saja-saja surgeon ataupun registrar nak practice buat arthroscopy. So they don't, whether this is indicated or not, there's no pure, not absolute indication to do the diagnostic arthroscopy. Then you do arthroscopy. That is indication is important to be informed, then indication must be correct. Okay, how the procedure to be performed. Okay, risk benefit of procedure including the side effect, and then you have to inform. Ini payah lah bila kita nak minta consent. Alternative treatment must be available. Okay, kalau kita tak buat ni, apa kita boleh buat? Okay, okay. Then you have to inform the likely success. What is the success rate of this procedure? What is the success rate if you do? If not do apa semua, what is more likely? Okay, this is what we call informed consent. There are few issues. I'm not talking about this one. Consent is, the problem is nowadays we are in hurry of this one. So the consent is limited in what was explained. Okay, especially in emergency. Kalau bukan emergency pun kita tak reveal everything. Kita takut nanti patient tak sign, so tak boleh nak buat operation. Okay, that is the things that you have to highlight here. The way we communicate the patient, explain to the patient is very important. Kalau you nak buat laparoscopic surgery, kita start dengan kita nak buat satu operation, kita tebuk 3 lubang, patient pun tebuk something like, I mean the way that we are communicating is important. Apa semua, although this is something simple, keyhole surgery apa semua, but the way that we explain is important. Patient have a refusal to consent. Okay, we have no right. Patient have a right. We have no right. Patient have a right to be explained properly. Kalau they refuse consent, we can explain it again until there is nothing we can do. Even that this is about a life-threatening condition. Okay, then this is doubt about the consent. Okay, doubt about the consent are resolved in the favor of preserving life. Maknanya kalau kita melibatkan nyawa, maqasid syariah to preserve the life, then we must be clear about the doubt about the consent. Okay. Another thing issue is family members want to give the consent, bukannya patient. Okay. Advanced directive consent, proxy informed consent. This is a family kan, yang family bagi consent. Okay. So about the communication, we touch a bit of a communication. We go further after. It's important for the doctors to teach teaching and learning doctor of the communication skill, to make sure they identify patient problem accurately, more satisfied with their care, and better understanding. Why this is important? Because they will leads to the behavioral change, perception of the patient, which is I think is important. Okay, the clinical competence. Okay, the communication was missing in the list of doctors. Okay, the better physician communication skill improve patient satisfaction and clinical outcome. Okay, then most important thing, we have to understand the good communication must be taught, can be taught and can be learned. Bukan benda tu actually is a gifted one. Okay, patient who feel at ease, who are encouraged to talk freely, are more likely to disclose the reason of consultation rather than they keep secret. Patient, we are responsible to dig what is a patient real problem. Okay, and then remember this communication and treatment advice, reassurance, support is part of they have a significant effect on recovery. Macam orang kata kan, jumpa doktor ni pun dah 70% dah recover dah kita punya ni. Tak bagi ubat, tak bagi apa pun, talking to the doctors. This is what we want. Okay. Okay, I'll touch a bit about Islamic spiritual care. Okay, this is what we mean by spirituality is this is something which is dimension of human being, refining of the soul, heart, spiritual well-being. This is about the meaningful and harmonious relationship of ourselves with others as well as the environment. Like we call it, is hablum minallah, hablum minan nas, and hablum minal alam. This is spirituality part of in Islam that we are talking about. Okay, and then in Islamic worldview, we related to the role and position as a servant as well as a khalifah, as a abid ataupun hamba, dan juga as a khalifah in this world. Okay, in Islam there is a bit different in terms of the Western belief in the religion and spirituality. The left side, the religion and spirituality is overlapping like this. Okay, sometimes people are spiritual, have good spirituality, but they are not very religious. Some people are religious. This is what the Western believe. But in Islam, we have to accept this because spirituality out of the religion, because religion actually is the victim for the Muslim, such as we have belief, then we have Islam, Iman, and Ihsan. Okay, our physically we have our body, soul, and spirit. This is things that we are believe in terms of the Muslim belief in the spirituality. And then we talk about the spiritual care, the spiritual or compassionate care involved in serving the whole person, not only physical, but also emotional, social, spiritual. And this is such service is inherent as a spiritual activities. Okay, I just list a bit example of the provider is the one who are serving, not the instructing. We are doctors, are providers. We are serving. We provide an active listening, compassionate presence. That's why physically it's important for us to present. Speak lovingly, positive, unconditional, and no judgment. Kita bimbang doctors ni, we see the patient, kita tengok patient first appearance, we are already judging the patient. We should be positively unconditional and non-judgmental. Okay, so this is a few guides. We have to ask patient of relevant questioning. Ask a patient according to the good questioning, like what Rasulullah teach us in the how we are deal with the Sahaba, also the famous stories of a person, young man come to see Rasulullah and then ask for permission to make a zina. So that is the part of the chaplaincy, the Muslim chaplaincy, in which the way that Rasulullah treat, that is the best way that we need to understand and then follow. We have to understand the patient reason, remain calm, especially in the provocative situation, and then don't be angry. Jangan doktor ni kalau boleh dia kena simpan dia perasaan dia apa semua. Don't be angry, especially in the crisis, managing the crisis. Okay, people really need hope. Relevant transformative advice is important for patient. That is important for counseling, important for we have to deal with the patient. Do your best. Whenever you deal with a patient, do your best. Always put this one as a part of a paramount in our heart. We have to do our best. Then don't expect anything from the patient, for anything else from the superior. Nanti kan apa? This is the important aspect that have to be in ourselves as a doctors. Okay, this is what we are doing in the hospital. We have a multidisciplinary team approach in terms of handling patient as well as relative. We have skill. We train the people to be skilled and experienced healthcare provider, as well as conduct quality research in the spiritual care so that we are improving. Okay, in the hospital, we have the policy. This is our policy in terms of a spirituality concept, how we are going to deal with everybody. So not only doctors and patient, but also the top management, the employee, patient, employee with the employees, employee with the employers. This is a part of the spirituality care that we taught in the hospital. Okay. Program what we do in the hospital, okay, and this is a spiritual care support that we give to the patient, talking to the patient, especially when we have referral with the need our motivation, support, or taking care of their ibadah in the hospital. Okay, that is a lot of benefit you get. Okay, we need to become a good listener, communicate well with the family's friends. We have to learn how to assess patient's spiritual issue, not only the physical issues. Then cultivate the volunteerism. Because we are during office hour, we are doing the work as doctors, everything. Spend few minutes, talk to the patient, listen to the patient, out of the time of your working, so that you can have a benefit. I myself actually become a doctor for about 26, 27 years now. But if you don't apply the principle of the spiritual care, we are only looking at the patient as a subject, as a patient only, as a disease, but not as a human being. That's important. The communication, education, motivation, and consultation in our work. Okay, the last part, actually, I will discuss a bit of the Sharia-based healthcare. Okay, Dr. Saiful, we still have time, eh?
Yes, Prof, we still have time.
Okay, this is what we are doing in the healthcare, and then it's related to you all. People talking about the Sharia compliant hospital whatsoever. So I just introduce the things which is a part of the thing which is important, I think. The Sharia means the way, okay, how Islamic law that govern all aspects of life in Islam. Compliance means this is just a big name. Kalau macam hospital, kita panggil hospital patuh syariah, syariah compliant hospital. Tapi macam kita dekat department syariah compliance, because it means that is acting of comply according to a certain set of standard. Okay, that is the different. Kalau kita tengok compliance depend. If you are talking about hospital, yes, hospital compliant, Sharia compliant hospital. Okay, but we are the one who are doing it. That means that is we have to compliance to that. Okay. In our definition, this is a definition that we use in the whole hospital. The hospital with accessible healthcare service and environment in comply with the Sharia principle or Islamic teaching and deliberate according to the Maqasid Sharia. Islamic paradigm value bioethic, culture, and healthcare professionals and other works and patients, incorporate the building, design, facilities, medical procedure, and the treatment available in the hospital according to the Islamic worldview. And all existing and useful knowledge and technology used in the hospital allowed to be used, but within the Islamic moral and ethical context through a process called Islamization. This is our SASMEC's definition of Sharia compliant hospital, which is agreed upon by our Sifu, Prof. Omar Hassan Kasole and Prof. Kezak previously. Okay, there is so many terms that we use: Sharia-based hospital, Ibadah-friendly hospital, Muslim hospital, but actually this is almost a similar thing. They are used interchangeably accordingly. But Ibadah-friendly hospital is championed by Ministry of Health Hospital. But this is also almost a similar thing, which is helping Muslim patient or non-Muslim patient in needs of our ibadah as well. Okay, we thought a bit of the previous principle, the idea, concept of this one. This is Al-Farabi, who are seeing the patient that we are doing the round right now. Okay, features of the Islamic hospital: they must be neat, tidy, have a clear water, abundant sunlight, which is against what the belief is in the Western, that the Middle East they are putting all the patient in the dark, put away from others, isolated in the dark, non-ventilation, everything. But when this is introduced by the early Islamic hospital, good ventilation, cleanliness, hygiene practice, food are high quality given to the patients, everything. And then the department start divided into, in terms of a departmental needs start during that time. Funding of hospital is revenue from Wakaf. The service of the hospital is free, open to everyone on 24-hour basis. Then have an adequate number of doctors and nurses and staff. I think this is during Abbasiyah, but even now we have a lack of doctors. A place of training, there must be a structured library, classes, everything, and then the quality of care must be subject to review to make sure that it's improving all the time. Okay, the idea concept of Sharia compliance is depend on people are seeking the healthcare treatment and serving on the healthcare provider, which comply with the principle of Islamic law. This is the policy that have been written, I think, in the 13th century. The hospital shall keep all patients, everybody, men, women, the far from far and near, resident or foreigners, strong or weak, low and high, rich or poor, employed and unemployed, blind and sight, everybody. Basically, it's everybody. And then their condition of considering and payment. That is what they are practicing previously. Somehow we are actually is in our setup. There is the free for all is very difficult for us to do. Okay, then the entire service is through the medicine of God, generous one. This is the policy statement previously, and then for us in the hospital, this is criteria showing that why we are the Sharia-based hospital. From Prof. Omar Hassan Kasole, the service procedure not contradict by following Sharia, but following Sharia principle, open to all. Everybody should be served. Strong financial status comply to Sharia principle, modern up-to-date medical care, adequate facilities, high quality, high technology, holistic patient care, including physical, mental, emotional, spiritual, social need, appropriate architecture design. In addition, Prof. KZ detail out more contemporary in terms of the guideline. We must be quality based. We have a panel of experts in our hospital. We have the Sharia advisory board. Okay, the facilities, policy, patient, and staff must be well written with the SOP. Must be incorporate the Sharia need. All product must be Sharia. Food, medicine, procedure must be complied. Training for the staff is a must. Then this is to become our aim, our major things that we are doing. Okay, guideline that we have for Muslim and other patient need or non-Muslim patient as well. Monitoring and a regular assessment, to maintain the quality. Okay, Islamic concept culture, which is I think in our hospital we have our SASMAC, we have Islamic motif. Oriented toward the Qibla in all direction. Design of every toilet has been oriented to the Qibla. This is a part of the physical part. But in whole Malaysia, there is a few hospital actually is comply. They say comply to the whatever requirement they need to become the Islamic hospital or Sharia compliant hospital. Okay, this is you call it need in line with the government initiative to improve the quality of our sector by following the Malaysian Sharia Index of 2015. Okay, there must be a guideline, clear guideline for handle Muslim as well as non-Muslim patients. In our hospital, this is a major activities that we are doing. I'm not going to do very detailed matter of our time, but you can learn it later on. But this is a part of the thing we are dealing in our hospital to implement as well as to evaluate and then re-improving our service as so-called the Sharia compliant hospital. Other than this is the common issue that is brought up, always brought up for the different. This is the health for all. Nowadays, our hospital also is quite ample. We have free charges for the government servant as well as ex-government servant for school children, everything. and then substantial amount of the fees for the other people as well. Gender interaction, okay, this is issues that we are solved by we have a policy on gender interaction, male to male. Whenever we are dealing with the patient, we need to have consent. We have to get the chaperone around. Not only whenever we see, nowadays we are talking about not only different gender issue, even the same gender, male to male or female to male, we need a chaperone as well, because there is a cases that I don't want to mention very detailed, but there is a problem male to male also. Nowadays, a lot of kind of the LGBT happen in terms of this. This is things that we need to have. We have policy on that. The aura issue as well. Not only for the patient, for their staff, for the doctors, nurses, and for visitors also. Anybody who are visiting us, there are policy in terms of the aura issue. Okay. And then the patient, we always emphasize the patient go to our operation theater. They should have this aura issue tackle, the dressing. Kemudian the person who actually is handling the patient, everything must be the ritual, must be arranged according to the principle of Islam. The financial management part, the hospital management, okay, there is in terms of our hospital is a fully Sharia compliance in terms of financial management. And then when we talk about the wakaf, so far we don't have the big wakaf for the hospital, but we are accepting it. We have the committee who are dealing with any wakaf and donation that given to the hospital. But not as simple as wakaf. Sometimes kan kita tak suka sangat guna perkataan wakaf kalau dia dah kita patient dermakan wheelchair kan, because the ruling for wakaf and donation is a different. In terms of the fiqh is almost similar, but when it comes to wakaf, the one who given amanah atau responsibility to take care of the wakaf, they have to deal. For example, kalau kita wakafkan kerusi roda, masalahnya bila tayar rosak kita kena tukar, bila brake tercabut pun kita kena tukar, everything, in which this is a more economic, kita throw it away and buy a new one. That's why kalau benda-benda kecil-kecil, kecualilah benda tu bangunan, tanah ataupun something which is we want to, because wakaf they have their own way of executing, macam harta jariah kita apa semua. Better give as the donation rather than wakaf. And zakat Baitul Mal, especially for financial support of the patient, the needy patient. Do we have it? Not for all. In fact, a hospital also from their profit, they already set aside kita panggil ihsan fund to help the needy patient. And then most of us can refer to medical social work to deal with all these kita panggil financial support for needy patient. And then a lot of things actually is going on. And then there is a lot of other things that involve in terms of muamalah for the patient in our hospital setting, in the healthcare, as well as interrelation between us and the patient, between us, doctors to doctors, doctors to employers, and everybody should be harmonized and should be in the proper manner. And then this is the way that we have to go. Okay, towards helping hand with the loving heart is our tagline. Okay, now people sebenarnya motto of the hospital, tapi bahasa orang sekarang is this is tagline of the hospital, helping hands with a loving heart. And for us, we have to avoid the medicine without soul, which is with that. Okay, in summary, muamalah is a guide for us. Learn muamalah, learn the proper way. Communication is the key for the good outcome. And then mainly for the barakah and betterment of the ummah and for the community and for our nation, inshallah. With that, I end my talk first, and then if we can entertain a few opinion or question, inshallah. Thank you. Back to Dr.
Thank you very much, Prof. Dr. Amin, for that wonderful session and also sharing. We have learned a lot regarding Prof enlightening us about patient-doctor relationship, about getting consent, about the principles of Sharia compliant hospital, as well as the major issue nowadays, even including the muamalah of wakaf, zakat, and batumal. I have one question, Prof, from the committee. I think they would like to ask Prof further about wakaf with regards to hospital management. They would like to know that what actually the role of wakaf that can contribute toward the hospital management and also improve on the financial resources of the hospital. Second, how actually the channels of what will be the channel for the public to be involved in contributing wakaf towards the hospital management. Thank you, Prof.
Okay, thank you for the question. Wakaf actually is a very important. In fact, if you learn from the histories of the Muslim hospital, the Islamic hospital previously, everything is done by wakaf. In fact, the big hospital during the Fatimiyah in Cairo fully actually is a form of wakaf. Wakaf can be property, can be the property. Wakaf can be the monetary. They can be anything that we actually is putting it so that they can become the jariyah for everybody later on. Okay, that's why I explained the two things just now, the wakaf and donation. In terms of the hospital, because I'm the chairman of the wakaf and the donation committee in the hospital, we are accepting all the things that we want to we donate or wakaf to the hospital. In terms of any monetaries ataupun any equipment, ataupun nak kalau you ada tanah you nak wakaf untuk a hospital untuk build up extra ataupun anything, okay, then UIA is talking about the wakaf time ataupun volunteerism. That is another thing that we can wakaf as well. Okay, but in terms of the proper term of a wakaf, that is a property ataupun anything that we can benefit to others. And then the wakaf is supposed to be something which is clean from the some syubhah, everything. Okay, the channel, you have to go through the Perkara Hospital, go through the PR. You can contact us, any of us in the Sharia department as well. Contact me and Ustaz Abdul Rahman as well, or anybody in the department. We usually you have to, because we need to consult. We have to see what is the things that you need to do wakaf, because like I mentioned just now, some of the things is difficult for those who are become pemegang amanah, because wakaf they need a pemegang amanah. Who's going to the pemegang amanah? At a certain amount, that is they can come to us. We are actually asking for permission from the Pusat Zakat and Wakaf Pahang to give us the authority to manage our own wakaf donation as well, because if the thing go there apa semua, we have the no control of it apa semua, but in the certain amount actually is counted. Not everything can be go through ours. We are actually still waiting for the letter of authority letter from them to manage it. But somehow, if the best actually is we are going to discuss it rather than you niat sebagai wakaf, maybe you niat sebagai donation, which is dia punya weightage almost similar, amal jariah juga, but because of the technical reason, certain benda macam we are talking about the ventilator gitu kan, portable ventilator, benda yang boleh jadi rusak dan mungkin kita tak boleh repair. Kalau wakaf ni susah, sebab bila wakaf memang kita kena baiki sepanjang, sebab kalau kita wakaf ni, kalau kita tuang benda tu, kita hapuskan benda tu, amal jariah orang tu dah hilang dah semua. Then which is back to kita sebagai pemegang amanah, because we are responsible to that. So this is going to be difficult for us, okay, to manage. The donation tak nak masalah. We have the something like macam bila orang bagi donation ke wakaf ke, dia ada macam-macam the term and condition, see whether this is suitable for that or not apa semua. That is how we are dealing with the harta wakaf untuk the hospital for the time being. Then we are working on the authority to deal with it directly, rather than we have to go through the majlis zakat, pusat zakat, which is handling the wakaf for the time being in Pahang, inshallah.
Thank you very much, Prof. Amin. We have one more question from the committee. I think it's related with communication. I hope it's still within this context of Muamalah. They're asking about the issue of bullying nowadays that happen among the doctors, and also can involve the postgraduate student as well. So what would bullied either by the superior or the colleagues, how they can actually voice out, how to communicate so that they can get back their rights, but in a proper manner, so that does not cause any damage to the culture or environment, the working area, Prof.
Thank you. This is a big issue when it comes to bullies and everything. I don't have the perfect answer for that because this is, even if you ask me how you're going to define the bulliness in the communication, in the interaction between doctors and doctor and staff, whatsoever, that if happen, this is about the perception of us. I'm not sure certain things when we make a joke with the doctors to doctors, some people perceive it differently. Some patient, some doctors or junior doctors perceive it differently. Depend on the things that happen. Okay, in terms of the practicality of that is a communication skill is very important. When we are following the guideline of the communication skill, which is Shari'i, which is according to the Islam, there shouldn't be any problem. Okay, whenever we deal, even we interaction, ini yang kita gariskan dalam kita punya guideline for the spirituality. It's part of a spirituality in which the communication between the superior and the one who are under us, under our supervision, that is important. They must be in the polite manner, and there is no harsh word come out. Though there is no such thing as the abuse, physical, mentally, as well as you do kita panggil herdik, you are cursing people in front of others. Sometimes the way that we are communicating, sometimes those who are actually scolding people in front of people, or they are saying something in front of others, or raise up their voice in front of others. There are a lot of different in terms of skills, in terms of this one, in which sometimes you want to kita nak bagi nasihat ke, kita nak tegur orang tu, dia cara dia. In Islam there is a lot of different way of dealing with that. Interaction doctors dengan doktor, kadang-kadang bukan bully, doktor dengan doktor, kan? Kita nak refer case ke, kita nak cakap doktor antara doktor dengan doktor, we have kita memang ada. I think maybe we need to read Prof Wan punya buku regarding this communication part, which is I think is very good. Is more kita panggil wiser Islamic way of do communication between us, even doctors to doctors, even the consultant with the MO, houseman, registrar, everything. Scolding people in front of others is another things that happening every day. Nanti kita mungkin juga kita kata kalau kita tak marah apa semua, dia buat pula apa semua. That is a balance things yang kita ni apa semua. Kalau kita tak bagi, tak teach them, tak scold them, then dia akan buat juga. But that is a way how to do it in the proper way. And not necessary you have to scold in front of others. Raise up, terutama kalau dengan nurses everything apa semua. You can tell them for the first time, second time, then apa semua. I always say, okay, you don't want to listen to me, call sister to me and talk to me. Then this is the way that in the hospital there will be hierarchy of people. We need to understand each other. We need to respect each other. Even though there is PPK je dekat ward, but we still have the good respect to them as well. We are doing our job. They are doing their job. That is kita panggil mutual things that we should do. We should have in our hospital. After all, kita ni tak lama duduk kat dunia ni, sekejap je kan. Apa gaduh-gaduh ke, marah-marah ke apa semua. But go back to the communication skill, the way that we handling anger, the way that we are dealing with the crisis, the way that we are communicating with others. That is a major part that I think need to emphasize again and again, and again. And then I think we have to put that as a part of the module that we have to deal with all our doctors, inshallah. Thank you very much. Allahu A'lam.
Thank you very much, Prof, for that answer. So I think that can conclude our session today with Prof Amin. Whatever it is, communication skills is really important, regardless in any fields, even with our colleagues, family members, even to the public and patients. Our characters do play a role in order to convince them, in order for them to agree to disagree with us with any situation that we face. Alhamdulillah, we have completed the lecture series for this morning. I would like to inform to all that there is some slight changes of the flow of program for today. We have been informed by Prof. Dato' Arif that he unable to attend for today's session because of some emergency matters that he need to settle for a while. So inshallah, his session will be shift tomorrow, inshallah tomorrow morning. And to replace his session, we have decided to bring in the group presentation that's supposed to be in the afternoon session to be done today, to be done now before we break for lunch. So inshallah, we bring earlier the topic for clinical Tawheed and clinical practice questions from the list of groups to be present now. Inshallah, I will be the moderator as well for this current session, and I hope that the remaining experts panels as well as speakers can stay with us until lunch. Hopefully, Prof. Nazri is here as well, Ustaz Abdul Rahman, also Prof. Amin. I'm really sorry that Prof. Dr. Wan cannot stay with us until lunch for now. I would like to invite the group presenters. We start with the first group presenters. The among the group members is Dr. Muhammad Hafiz, Dr. Muhammad Taufiq, Dr. Muhammad Firdaus, and Dr. Muhammad Faik on topic Tawheed principles. They are from the Department of Orthopedic Department. Among the questions be given to them to be presented in 10 to 15 minutes are: describe Tawheed definition and its principle, application of Tawheed during what rounds, and please comment and answer based on the scenario that you are in charge of the male ward in your hospital. During on-call, you realize that all of your Muslim stable patients are not performing Salah, and how can you educate and encourage your patients to comply with Salah obligations? So I'll invite the session to Dr. Hafiz and his colleagues. You may start now. Dr. Hafiz, are you here?
Assalamualaikum, Dr. Syaiful and Firdaus.
Yes, Dr. Firdaus, you may proceed, hopefully within 10 to 15 minutes.
Okay. Assalamualaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. Alhamdulillah rabbil alamin wassalatu wassalamu ala asyrafil anbiya'i wal mursalin wa ala alihi wa sahbihi ajma'in. رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي. My name is Muhammad Firdaus bin Azizi from Group 1, representing my other colleagues, which is Dr. Muhammad Hafiz Shazwan, Dr. Muhammad Faik, and also Dr. Muhammad Taufik. We are from Year 1 Orthopedic Department of IIM. So today we're going to present on Tawheed principles based on the specific topic that are given to us. So without further ado, I'll start my presentation. So first, I will explain regarding Tawheed definition and principle. So some of the slides, some of the topics actually already covered by our lecturers today. Okay, but we'll just have a recap on the topic. Okay, first, the term Tawheed actually came from the word Wahid or Ahad in Arabic, which means one or one and only or singular. So while the Shari'i definition is believing in Allah alone as God and Lord and attributing to Him alone all the attributes of Lordship and divinity. So the term, the concept of Tawheed was explained in Surah Al-Ikhlas in the Quran chapter 112. Bismillahirrahmanirrahim. Allahu samad lam yalid wa lam yulad wa lam yakul lahu kufuwan ahad, which means say He is Allah, the one and only, Allah, the eternal, the absolute, He begetteth not, nor He is begotten, and there is none like to Him. Okay, and the concept of Tawheed also was explained in a hadith by on the authority of Abdullah, the son of one of the close companion of Rasulullah sallallahu alaihi wasallam, which is Sayyidina Umar ibn Khattab, which said that I heard the messenger of Allah say, Islam has been built on 5 pillars, which is number 1, testifying that there is no deity worthy of worship except Allah subhanahu wa ta'ala, and that Muhammad is the messenger of Allah. And then include establishing the salah, paying zakat, making the hajj to the and also fasting in Ramadan. This is based on Sahih Bukhari and Muslim. So Islamic scholars have divided Tawheed into 3 categories. Okay, which is Tawheed al-Rububiyyah, Tawheed al-Uluhiyyah, and also al-Asma' wa Sifat. A bit in each type of categories. First, Tawheed al-Rububiyyah, which believing in Allah as one and unique with regard to His actions such as creation, sovereignty, control, giving life and death, and so on. So whoever believes that there is any other creator other than Allah, or any sovereign controlling this universe and disposing of it as affairs other than Allah, has denied this aspect of Tawheed and disbelief in Allah. So whoever affirms this Tawheed in the true sense must inevitably also affirm the one of Allah SWT divinity, which we covered by the Tawheed al-Uluhiyyah. So Tawheed al-Uluhiyyah specifically refers to devoting all acts of worship, both inward or outward, in words and deeds, to Allah alone, not worshiping Allah. This is also called Al-Ibaadah, honest of worship, because it means that a person worships Allah by doing what He has commanded and avoiding that which He has forbidden. It is also called Tawheed al-Talab wal-Qasd wal-Iradah, oneness of goal to person will, because it means that the person does not seek anything except the face of Allah, so he worships Him sincerely. And lastly is Tawheed al-Asma' wal-Sifat, the category of one other category of Tawheed, which affirming the names and attributes of Allah SWT and believing that there is none like unto Allah in His names and attributes based on 2 principles. Number 1 is affirmation, affirming which Allah has affirmed for Himself in His book, or that His prophets, peace be upon him, has affirmed of His beautiful names and sublime attributes in a manner that suits the majesty and greatness of Allah, without distorting them, twisting their meanings, denying their reality, or discussing how they are. And another principle is denial, which deny that Allah has any faults and deny any shortcomings that He has denied Himself. So the evidence for that is the words of Allah SWT. So we'll go on to part number 2, okay, which application. How do we apply Tawheed during what rounds? Okay. in terms of implementation, and also what are the implications and the benefits that we'll get from application of Tawheed. A bit introduction. So the Muslim identifies the only God, which is Allah Ta'ala, as the ultimate healer. So God is the true source of health and illness, life and death. So medications and doctors are an instrument of healing of a patient. So in health, the concept of Sunnatullah fil al-Kaun, which can be understood when we discuss specific etiology of specific disease. So it's basically explained that the law of cause and effect, which means the rule of causality plays a major role in understanding health and illness. We mean that the order or specific event, for example, in our setting in terms of health and diseases, so it actually comes from the specific cause and the after effect of the causality. So the similarly in seeking treatment, appropriate measure or ikhtiar should be sought. So seeking inappropriate treatment against the general laws of nature would be inconsistent with the rule of causality. In illness, the Muslim is encouraged to seek for the cure. So however, the cure must be logical and consistent with the rule of causality and sunnatullah fil al-kaun. The Muslim accepts God's qada and qadar without qualms. In health, as a consequence of this understanding, the Muslim seeks for a cure and then put his trust in God, which means he tawakkal, with regard to the outcome of the therapy. So the concept of healing, okay, basically explained in the Quran, okay, by the healing of specific illness by Allah SWT was explained in Surah Ash-Shu'ara. Okay, wa idza maridtu fahuwa yashfin. When when I am ill, it is He who cures me. And also in Surah At-Taubah, wa yashfi sudur qaumin mu'minin, and Allah shall heal the hearts of the believers. And also another example in Surah Yunus, verse 57, which narrate is, O mankind, there has to come to you instruction from your Lord and healing for what is in the breast and guidance and mercy for the believers. So, how do we implement these principles of Tawheed, okay, during ward rounds, okay, in our daily practice? So, firstly, the Muslim doctor can always remind the patient to believe that all the illnesses and diseases are created by Allah, and only to Him we ask for cure. Okay, and also the Muslim doctor can make the patient understand the importance in seeking appropriate cure and treatment based on their disease. So inappropriate treatment will lead to failure and may worsen his or her condition. So the doctor who treat the patient also may recognize if the patient are seeking for other healer than Allah Ta'ala or equating his essence, because this might lead to shirk, which means that accepting that there's other entity that can heal him rather than Allah Ta'ala. And we can advise the patient to ask for repentance, okay, in case we face of any of the situation. So other methods of implementation, okay, to constantly reminding the patient to pray or salah even during difficulties. Excuse me. Even there are difficulties in performing salah, because there are ways in performing salah with limitation. So we can have a pictorial guidance or handbook on how to perform salah. Okay, number 5 is to inform the patient which have no caretaker to ask for help while taking wudu during prayer time. And each ward actually can prepare a spray bottle for each patient to each ablution. And one more method of implementation is to have a multidisciplinary involvement in case we find patients who have a disbelief, okay, because maybe some patient may face with depression when have a severe illnesses. So we may refer the patient to the expert in these sorts of problems, so that the patient can come back to the correct pathway. So in applying Tawheed, okay, during our daily practice or during ward round, it can lead the patient to have a good understanding of the illness, okay, a good understanding of the illness seeking treatment concept, so that he can inculcate the correct thinking and also concept the patient will actually will agree on the proper and better treatment and management as suggested by the treating team. Okay, he will be more motivated to comply and adhere to the treatment and medications which prescribed for him. Okay, patient also will have a good faith in Allah SWT and become a better believer as a Muslim, considering having a disease that he can accept that it is a test from Allah SWT and able to accept the qada and qadar with an open heart and calm. And also, patient will understand the concept of tawakkul. So the case scenario that are given to us basically mentioned that you are in charge of the ward in the hospital during on-call. You will that all your Muslim stable patients are not performing salah. How can you educate and encourage your patients to comply with the salah obligation? Some of the basically some of the methods we already covered in the implementation. The implementation part just now on what can we advise, but we add some other things that can lead the patient on how to comply with the salah while admitted and having the illness. Okay, so number one is to create an atmosphere in the ward that encourage the patient to perform salah. For example, we can put the kiblat direction available in each cubicle, so it is easier to be identified by the patient. Yeah, and then the beds allocation that follows the direction of the kiblat. Allocation of a clean attire to perform salah to each patient, and provide water spray for ablution or wudu in each bed to each patient who is unable to ambulate to washroom. And also we can put a prayer timer to encourage the patient to perform salah at the beginning of each time. Okay, for example, these are the example of the item that we can put in the ward to encourage the patient to perform salah, okay, while admitted to the ward. Other than that, is to provide a guide to perform salah during illness. Okay, it can be provided in several forms. For example, a pamphlet given during orientation of hospital admission, a booklet in each bedside, okay, and also posters in reading corners or ward entrance on the station, and also by multimedia modalities. So these are the example of a pamphlet that prepared by some of the medical centers. Okay, basically it explain how to perform wudu or the patient or tayammum if the patient cannot touch the water, and also there's also direction on how patient to perform salah if he cannot perform by standing, maybe by sitting, not by sitting, by lying down, or if he also cannot perform by lying down, maybe by using the eyes only. And also we can keep telling the patient to keep giving a constant reminder on benefit of salah during ward rounds. Okay, for example, there are physiological benefits of salah. Okay, there are continuous gentle muscle contraction and relaxation with different types of stretching and isometric contraction exercise. Basically, these are by performing salah, it can help provide a continuous gentle muscle contraction and relaxation with different type of stretching and isometric contraction exercise. And the 12 rak'ah of salah is equal to 30 minutes of light exercises daily as recommended by health expert. These are by the study done. And then another study also shows that the energy cost of 2 and 4 rak'ah prayers in 32 male and female adults found that salah has a positive effect on metabolic function. There's also psychological benefit of salah. For example, performing salah can lead to relaxation, decrease in tension, increase focus and stability between the mind and body. And also another study revealed that the parasympathetic system activity increased while the sympathetic system activity decreased during salah. So this in turn leads to improvement in mental and physical recovery of patients. So we can explain regarding this study to the patient, explain the benefits so that the patient can be more encouraged to perform salah while admitted to the ward. And also, other than that, we can arrange an Islamic discussion session with patient in ward. We can create a small group in which patients can have a discussion on beneficial topics such as health, Islamic, economics, prayer, etc. Patient can have a healthy discussion, lead to healthy minds and increase motivation. We can also invite a professional educator, teacher, counselor, or ustaz to help in discussion and motivate the patient to perform ibadah even the illness, and also we can involve in visiting family members in the group discussion. So basically, these are our references. That is all regarding our presentation. I'd like to open to Q&A.
Alhamdulillah. Thank you very much, Dr. Firdaus, for that wonderful and concise, well-explained discussion on the task. The aim of this group presentation is not to find which one is right, which one is wrong, but it's more for us to share our opinions and also to give some practical solutions so that we can share to all our colleagues. So I really feel happy regarding your suggestion and also your practical solution, especially that if we would like to remind our patients regarding performing solar obligations, well, first of all, we need to be the role example of them. So the way that we talk to them, the way that they observe us also performing solar during a specific time, also that can encourage them, remind them regarding the need to perform their obligation. Second, we can't really say much if there's no facilities or the requirements for them to perform the solar at their bedside. So the suggestion just now by the group regarding the Qiblat direction is available, the time reminder, the requirements to perform wudu, the water bottle spray and so on is available for them. So I think this will make them much more easier to perform solar during that difficult condition while in hospital. So I think that's from my input. I would like to invite from Prof. Amin, also Prof. Nazri, to give any further info if there is. Prof.
Okay, Assalamualaikum.
Prof. Nazri, yes, Prof.
Sorry. So I think simple thing you can do is by when you meet patient, you say salam, because salam is a dua. I mean, peace upon you. Something good for the patient for the beginning. And then frequently use the word inshallah. Inshallah means hopefully may Allah do. What is the meaning inshallah? In English, in Malay.
May
By
Allah,
the will of Allah.
by the will of Allah, yes.
Yeah. Okay. So and then of course if you want to do something, start with Bismillah. These are all the words and zikr that we frequently use when we do our works. And then I think it's a good practice. Of course, in UIA we always ask history of how they can perform the salat, right? In orthopedic, especially if they have knee pain, how do you perform? If you have an difficulty in performing salat. So that is actually part of the history taking that in orthopedic, which we practice that in UIA. So I think by doing that, I think it can be indirectly, it will help the patient to understand that they are in Islamic environment. So when you are in the Islamic environment, you are more prone to do Islamic thing, I suppose. Okay, thank you.
Thank you very much, Prof. Nazri. So I think that's can conclude about the principles of application while doing ward rounds and interaction with patients in ward. Now I would like to go to the next group presenters from Department of Surgery, whereby the question quite similar, but it's much more related with operation theatre and surgical routines. So again, the question describing the Tawheed definition and application of Tawheed in operation theatre or surgical routines, and also to comment on the case scenario whereby the question is that you notice that the operation that you are going to perform would last almost 8 hours. You begin the operation electively at 11 a.m. How would you ensure that all your surgical team members would have the opportunity to perform solar? So I invite the subsequent presenters from group surgery, Dr. Muhammad Afiq, Dr. Muhammad Daniel, Dr. Amira, and also Dr. Muhammad Haris. Please proceed. Thank you.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh, and a very good afternoon. Can anyone see my slides and my voice?
Yes, we can hear you, Dr. Afiq, and we can see your slide. You can start the slideshow. Thank you.
Assalamualaikum to all consultants, teachers, lecturers, Prof. Jamal, Prof. Aminuddin, Prof. Arif, Ustaz Rahman, Dr. Shaiful, and all the lecturers and fellow colleagues. I am from Group 2. My group members are myself, Muhammad Afiq, Muhammad Daniel bin Abdul Latif, Nur Amira binti Izhar, and Muhammad Haris bin Hamisi. And Mr. Irfan Salmi is our supervisor. So the topic that we've been given to us is regarding Tawheed principles and the application of Tawheed in operation theatre, and also so first and foremost, I think only one slide regarding the definition of Tawheed, already explained by Dr. Firdaus just now. Just a recap, the concept of Tawheed, which is the concept of oneness of God, of in Islam is Allah, is the indivisible oneness concept of monotheism in Islam. And it can be divided into the Tawheed al-Rububiyyah, al-Uluhiyyah, and Asma' wa Sifat that had been described by Dr. Firdaus just now. So I think I can proceed with the topic or the problem matters that are going to discuss for our group. So the first question, the first problems or that I'm going to explain is regarding the application of Tawheed in operation theatre or surgical routine. So how it can be implemented, basically, the first thing is that we have to understand the ultimate healer is only Allah. So all Muslims or non-Muslim must identify that only God is the ultimate healer. God is the true source of health and illness, life and death. And the medications and doctors are only the instrument of healing that the Quran states in chapter 26, Surah Al-Shu'ara, verse 80. And when I am ill, it is He who cures me. So the second concept is everyone must understand the causality and ikhtiyar concept. In health, the concept of Sunnatullah can be understood when we discuss specific etiology for specific disease. For example, the KRAS mutation for the cancer, and all these attribution of diseases inappropriate to etiology and risk factors is due to lack of understanding of this concept. The role of causality plays a major role in understanding health and illness. So in everything we do, each time you go for a lecture or a new knowledge that you know, actually will increase your faith towards Allah, which means that everything happen is based on Sunnatullah. And similarly, seeking treatment, appropriate measure or ikhtiyar should be sought, and seeking inappropriate treatment against the general laws of nature would be inconsistent with the rule of Sunnatullah. In illness, the Muslim is encouraged to seek cure. However, the cure must be logical and consistent with the rule of causality and Sunnatullah. So the last but not least is the concept of qada, qadar, and tawakkal. So based on this concept, all Muslims must understand that God knows everything in pre-eternity, including what happened, what will happen, and whether good or bad. Qada can be understood as His creation of things, and even when their time is due, based on His pre-eternal knowledge in ordaining. In the long narration of the Prophet Muhammad sallallahu alaihi wasallam, told that inform me about Iman. He, the Prophet, said, it is that you believe in Allah and His angels and His books and His messengers and in the last day, and you faith of Qadar, both in its good and evil aspects, reported by Muslim and Nawawi in 40 hadith. This is actually pillars of faith in Islam. The Muslim must accept God's Qadar and Qadar without qualms. So in health, as a consequence of this understanding, the Muslim must seek for a cure, then put his trust in God. Same with all doctors or healers, must put trust in God, which is tawakkal, with regards to the outcome of the therapy. So based on all these, we're going to implement for the surgical routines. So before surgery, usually when we understand patient disease better, is according to Allah's will, and it's not spontaneously or due to natural laws. So we have to believe that everything does not exist before Allah created and made it exist. This is to avoid attitudes or opinions that believe in the law of cause and effect in the creation of the universe and its contents. Allah is Almighty. He not only creates the disease, but also the cure. So while doing surgery, everyone must, surgeons or doctors must conduct the procedures diligently and with full responsibility, as Allah Subhanahu wa Ta'ala is all seeing and all knowing. And believing in the existence of God as the creator in order to be free from atheism or the exclusion of God. So a surgeon should perform their best and put their trust in Allah during conducting surgery. And after surgery, believing in the qada and qadar. Always put tawakkal to Allah after out of best performance. So what is the implications and benefits? So when what doctor or surgeons put Allah Subhanahu wa Ta'ala as the ultimate healer, once will perform their best as they know Allah is all seeing and all knowing, as their action and deeds will be judged in akhirat. By understanding these principles of causality and ikhtiyar, one will try their best to find the cure. And tawakkal and believing in Qadar and Qadar will help doctor or surgeon to understand their limitations as human beings and know when to stop after trial of their best. So the second problems or issues that I'll be going to explain or discuss is about regarding a jamak prayer for operating surgeons. So the questions given is, you notice that the operation that you are going to perform will last almost 8 hours, and you begin the operation electively around 11. How will you ensure that all your surgical team members will have the opportunity to perform solat? So started at 11, so around 8 hours should be end by Maghrib, after Maghrib prayer. So during this period of time, the solat Zuhur, solat Asar and solat Maghrib will be missed based on in these 8 hours. So how are you going to plan? So first and before that, everyone must understand that the original ruling for obligatory prayers is that they should be fulfilled at their designated times, and this is based on the statement of Allah in Surah An-Nisa verse 103, Inna salata kanat 'alal mu'minin kitaban mawquta. Indeed, prayer has been decreed upon the believers a degree of specified times. So, and some contemporary scholars and body of authorities' opinions on performing jamak in operation theatre. So based on the use of Al-Qardawi in Fatwa Al-Mu'asirah, it is permissible to perform jamak prayer of Zuhur and Asar, Maghrib and Isya in Taqdim or Takhir in accordance with what is easy for him. This is performed in jamak without qasar according to the opinion of Mazhab Imam Ahmad, who permitted jamak for any debility according to the hadith of Ibn Abbas in As-Sahih. And Sheikh Walid bin Rashid Al-Sa'idan in his book Al-Qawaid Al-Syariah fil Masail At-Tibbiyah, page 30, it is permissible for a surgeon to perform jamak if he isn't able to perform his prayers in their prescribed times due to being in surgery. And based on Lajnah Daimah Lil Buhuth wal Ifta Arab Saudi in Fatwa number 20913, the doctor specified to perform the surgery should be mindful of the prayer and perform it in its time. However, it is permissible for him in an exigent situation to perform jamak taqdim or takhir for his prayers such as Zuhur and Asar, Maghrib and Isya when an exigent situation arises. So based on these three references, we are allowed to perform jamak prayer is either taqdim or takhir without qasar, based on what is easy for the surgeon, and it is permissible. So for us, it is suggest what's the best suggestion is you have to divide the operation, whether it's an elective or emergency operation. And for an elective operation where the patient's life is not in danger, whereby in the case of non-sepsis patient, for example, provided that the operation is in a well-controlled and stable manner, the team should dedicate and divide among the personnel to take turn in performing solat. As in the team, usually there will be a consultant, surgeon, and a medical officer. So based on the situation, for example, during opening of the peritoneum, for example, it can be done by a medical officer or a postgraduate student or a surgeon. And during this time, maybe the consultant can take turn to perform the jamak, the jamak solat jamak first. It's either qasar, so it's a takdim, it's usually takdim. And then during the situation where in the colorectal cancer case, for example, during the mobilization of the bowel, so maybe the medical officer can take turn to perform his solat next. And then based on this situation, and the specialty requirement, the team can properly divided to perform solat. So this is in the case of elective or stable patient. So in the case of an emergency case, where there is no replacement, for example, during on call, and the emergency operation must be done immediately, and and there's a threat or risk to the life of the patient. So the solat can be performed once the life should be take into account first, the life of the patient, and then you can perform your solat after the operation. And this is in the case of if the doctor leaves the patient, then his action will risk or threaten the life or delays the healing process for the patient. So if the emergency where patient is stable, may follow the step as previous case. So I think this is what we are, based on our discussion with our supervisor, I think this is what we are recommended for surgeons or any doctors that are going to do long hours procedures. So with that, thank you to everyone and all my colleagues for the slides.
Thank you very much, Dr. Afiq. Yes, I'm really interested. I really feel happy and also feel that's also very practical, because you did involve regarding the concept of Tawheed before the surgery, intra-op, and also post-op or post-procedure surgery. And also you involve regarding the belief and trust in Allah, in tawakal, in takdir. And with that, we try to do our best in performing the surgery. We just not only rely on that current situation, but we're also doing the best for our patient to save their lives. And about the practical question that we give to your group, I really feel that that's the best answer, because as a surgeon, also as a clinician, you will be the leader and you will decide which one will be the best person to perform solat at a certain point of time. And you intend to do the jamak. And in the situation whereby the operation is an emergency and the patient is not stable, definitely when we're talking about essential maqasid, so we will try to weigh which one is more important. So definitely the duty to save the patient's life is important. And after that, inshallah, if the situation going back to a stable condition, then the doctors can perform solat according to their sequence. So I think that's the best answer so far for that situation. Maybe I can open to Ustaz Abdul Rahman if Ustaz still here, or Prof Nazri and the other expert panelists would like to add something. Ustaz.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Dr. Afiq and these members. I think it's a good presentation, based on practical, good suggestion, solution. Just what can I suggest, if possible, to perform in emergency case? I'm not sure whether it can perform the salah in the OT, maybe in the side OT, inside the OT, and perform the minimum requirement of salah. Just Al-Fatihah, maybe the simple one, and this tasbih for once, only for once, and finish. Maybe it's another pilihan lah, choice yang ada. The best as suggested by this group, we can take turn and so on. But if not possible, maybe another way we can perform the solat. Sebab kita our tabu solat ni mesti kena ada sejadah, mesti kena ada pakai sebagainya. But it's simple. Sebenarnya simple kalau possible. Tapi kalau babitkan hygiene and so on, kita tengok balik lah. Just to add that point.
So Ustaz, if I can ask for this, so meaning that do the minimal requirement for solar during that operation theatre, and after that we qada, or how, Ustaz?
If we do the minimum requirement, so the solar is valid, so no need to qada.
All right, noted, Ustaz. Thank you very much. So thank you very much to all for that great discussion. So now we shift to the next group, the last group of this topic on Tawheed in clinical practice. We have heard and listened to the group just now from, I think, surgical base department. So we would like to know about the solutions in the medical base department, inshallah. So we have the group members, Dr. Ahmad Zulhazwan, Dr. Zulfadli, Dr. Sumaya, and Dr. Norajwa binti Saroni. I think it's a mixture of internal medicine, also ONG posting. The question given are application of principle of Tawheed in clinical routines, describe Tawheed definition, application of Tawheed in clinical routines, how it can be implemented, and also please comment and answer based on the case scenario. You notice that your outpatient clinic in the morning session always ends around 3 p.m. So the very busy clinic sometimes end even after lunch, even up to 3 p.m. So how can you as a senior doctor in the clinic can help and ensure your colleagues have a chance to pray Solat Zuhur early? So I pass the session to the presenters. Please proceed. Thank you.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Okay, I hope everyone can hear me.
Yes, we
Okay,
can hear you.
So, okay, I am representing team 3. My name is Zulfadli from ONG department. With me is Sumaya and Nurul Najwa, and also Dr. Azwan from the department. So we're given the task on to describe Tawheed definition application of Tawheed in specifically clinic routines, and the case scenario as read by Dr. Shaiful just now. So I think it's kind of duplicates from the previous group. The first task given to us is to describe Tawheed definitions. Basically, our reference define the Tawheed as we know is a oneness of God, monotheism, and understanding that there is only one God, Allah Subhanahu Wa Taala. And then it is easily understand by 3 concepts of Rububiyah, Uluhiyah, and Asma wa Sifat, as described earlier by the previous group. And then we know from Surah Al-Ikhlas, Allah mentioned in Surah Al-Ikhlas verses 1 to 4, Qul huwallahu ahad, Allahu samad, lam yalid wa lam yulad, wa lam yakul lahu kufuwan ahad. Say He is Allah, who is one. Allah is the eternal refuge. He neither begets nor is born, nor is there to Him any equivalent. So the Tawheed concept is basically understandable by this chapter. And then by this chapter also we know that there is a concept of shirk. Shirk is defined as polytheism, manifested as taking rivals for God, worshipping other than God, and equating his essence attributed to others. So, what we can understand from this concept of Tawheed, there is relation to the concept of principle of causality and ikhtiyar. As we know that there is sunnatullah fil al-kaun, as described also earlier. In the health concept, the concept of sunnatullah can be understood as there is, when we discuss specific etiology, especially during clinic. Example is streptococcal infection. We know it is a known etiology for post streptococcal glomerulonephritis. And then also attribution of a disease inappropriate to its etiology and risk factor is due to lack of understanding of this concept. And then similarly, in seeking treatment, appropriate measure or ikhtiyar should be sought. Seeking inappropriate treatment against the general law of nature would be inconsistent with the rule of causality. As I may quote Prof. Azman lecture just now, a resigned carefree attitude expecting a miraculous intervention is delusional. So we may counsel the patients in clinic that refuse for treatment with this logical judgment. So the third, what I understood from the concept of Tawheed is the principle of qadar and tawakal. As we know, Muslim understands that God knows everything pre-eternity. This includes what happened and what will happen, whether good or bad, from pre-eternity to past eternity. He ordains or determines the place, time, and characteristic of these events. This is qadar. The qadar can be understood as his creation of things and events when their time is due. Of Prophet Muhammad inform me about iman, faith. The Prophet said it is that you believe in Allah and His angels and His book and His messenger and in the last day, and in faith, qadar, both in its goods and evil aspects. And also reported by Muslim in An-Nawawi, the Muslim accepts God. Yeah, that is reported in Muslim An-Nawawi. The Muslim accepts God, qadar without qualms. In health, consequences of this understanding, the Muslim seeks for a cure, then puts his trust in good tawakal with regards of the outcome of therapy. So based on our understanding of the Tawheed, how this can be implemented, we know all these can be implemented in clinics during our counseling with patients. We can apply the concept of Tawheed and Shirk, the concept of causality and ikhtiyar, the concept of qadar and tawakal. Of scenario when the patient coming early stage of cancer patients instead on natural unmedicated treatment, we can explain to the patient that the concept causality and ikhtiyar, and also the concept that is Allah is the ultimate healer, where doctors' medications only means and instruments of healing. As in Surah Ash-Shu'ara, chapter 26, verses 80, wa iza maradtu fahuwa yashfin. And when I am ill, it is He who cures me. So it is important for us doctors to make a good doctor-patient relationship, and also to make them understand that everything good and bad belongs to Allah, and we must ask Allah for cures. And then also for patient, another example is couple coming for infertility issues. Wife keen for checkup, but husband refused to give cooperation. This the fertility conflicts bring disharmony to the relationship. This also goes back to the concept of causality and ikhtiyar. If only the wife seeks for treatment and then the husband refuse, then the concept, there is no harmony. There is that it can't be done. The fertility, our treatment cannot be done. And also the concept in transgender person seeking perfection, and also when Allah has decided that the baby in the womb is having Down syndrome and with diagnosed by antenatally by ultrasound. This is also the concept of qada and qadar in accepting Allah's order. So how we can apply this in clinic? We must show a positive attitude towards to overcome the illness. And then this can enhance recovery, and patient can cope better with illness and with pain and life stresses. And also we rest the outcome, we rest after ikhtiyar, we rest the outcome to Allah Subhanahu wa Ta'ala power. And then patient's acceptance is easier. And also if there is any any bad qada and qadar, I mean any diseases any shortcomings, the grief period is can be accepted in shorter time, and it gives peace to and solace to the patients and family. And then the concept of tawakal, when all means are exhausted, we refer back to Allah, and this concept is known as tawakal. So we know that every medication we need to take it in the names of Allah, and then we ask to offer supplication to Allah, to dua, and also this can all this implementation can benefit patients and doctors in strengthening their akidah and strengthen Tawheed. As we all know, the Muslim identifies that only God is the ultimate healer. God is the true source of health and illness, life and death. Medications and doctors are only means, instruments of healing. Okay, so for the case scenario, we are given a scenario that we, the senior doctors in the clinic, noted that outpatient basically as what's practiced in IIM as a Sharia compliance hospital. We need to be alert, and then the hospital management also is alerting us on the pre-prayer reminder announcement. And then we must have enough doctors, enough staffs, enough nurses, so that we can delegate tasks better, and then we can have enough time to perform prayers. And also maybe it's not practical, but we may limit number of clinic patients, or perhaps we can divide the numbers. If it's too huge, we can divide it into morning and afternoon sessions. And also if I may add, in the hadith by Ibn Majah in Sahih and also in Sahih Muslim, Jabir bin Abdullah says, I heard the Messenger of Allah sallallahu alaihi wasallam saying, the difference between a believer, a Muslim, and a shirk and kufr is the abandoning of salah. So we must remind our colleagues and also our patients that the importance of salah. And also is mentioned in the Quran, inna salati kanat alal mu'minina kitaban mawquta, in mawquta, in chapter 5 verses 3, surah An-Nisa. So Allah says in the Quran, set up regular prayers, for such prayers are enjoined on believers at stated times. So we know that there is rukhsah in salah, but we don't want to just simply jamak to asar in this case. As we know, the clinic is actually a clean place. If it is not possible for us to salah in the proper room in the musalla, it also can be done in a matter of 5 to 10 minutes in the clinic. And then we can continue our clinic if we are unable to limit the number of patients or divide it into morning or afternoon sessions. I think that is about it from us, from team 3 under supervision of Dr. Amin.
Thank you
Thank
very much,
you.
Dr. Zulfadli, for that wonderful presentation. So I do agree with the answer for the question number 3 that the concept of Jama is not applicable in this situation, as OPD clinic most of the time are stable patients, and it's not about unless there's some emergency cases, it's not that often, and usually we have some other colleagues to help us. So it's good that we can delegate the task accordingly so that we can remind our colleagues and our friends to perform solar according to their turns. And inshallah, it will not take quite long time, probably about 5 to 10 minutes, and that's not going to disrupt the flow of the clinic during that busy hours. So I think that's the only input from me. Any input from the others, speakers, panels, or even the participants? If not, I do receive some messages from all the participants and some of my colleagues that there are currently some problem with the electrical supply in area of Kuantan, most areas of Kuantan. So I hope that we can still sustain in this online virtual platform, hopefully until the afternoon, and I hope that the situation will return back to normal. If there's no further input, I would like to end our morning session now at this current time. Inshallah, we're going to restart back at 2 p.m. And I would like to inform that the moderators for the afternoon session will be by Dr. Iqbal from Department of NS and also Dr. Amin from Department of Medical. So thank you very much. Assalamualaikum, and please join back us at 2 p.m. Thank you very much.
صل وسلم دائما أبدا على حبيبك خير الخلق كلهم. مولاي صل وسلم دائما أبدا على حبيبك خير الخلق كلهم. يا نبي سلام عليك، يا رسول سلام عليك، يا حبيب سلام عليك، صلوات الله عليك. صل على النبي وتبسم، ده النبي تبسم وتبسم، ده النبي تبسم. اللهم صل عليه. قلبي المتيم كلما صلى عليك وسلم ذاق السعادة مغرما. يا سيدي يا محمد صلوا عليه شافع الأمة، بذكر الرسول تشحذ الهمة. يا ربي بجاه النبي أزح الغمة، يا ربي بجاه النبي أزح الغمة.